All right, so let's dive into something that I think we all deal with at some point, and that's pain. And specifically those go-to pain relievers that we find ourselves reaching for. Today we're doing a deep dive into three of them: acetaminophen, ibuprofen, and ketorolac. You've probably used at least one of these, but I bet there are some things about them you didn't know. And joining us is an expert in pharmacology who can break all this down for us. What are the key differences between these medications, and when is it best to use one over the other? Let's get into it.
Yeah, it's a great place to start because, while these medications might seem interchangeable at first glance, they actually work in very different ways within the body.
Okay, let's start with acetaminophen. I feel like that's one I use most often for like simple headache or a fever.
Yeah, you're not alone there. Acetaminophen is incredibly common. It works primarily in the central nervous system to block pain signals and reduce fever. Imagine it like intercepting those pain messages before they even reach your brain.
So it's like cutting off the communication lines for pain? That's pretty
Yeah,
clever.
yeah, exactly. However, and this is a key distinction, acetaminophen doesn't have much of an effect on inflammation. So for something like a sprained ankle where swelling is a major issue, it won't be as helpful as, say, ibuprofen.
Okay, that makes sense. So while acetaminophen might knock out my headache after a long day staring at a screen, it won't do much for my knee if I overdo it on a run.
Precisely, and that's where ibuprofen comes in. It's part of the NSAI family, those non-steroidal anti-inflammatory drugs, and it targets inflammation directly.
NSE8, that sounds way more serious than acetaminophen.
Not necessarily. It just means it has a different mode of action. Instead of working primarily in the central nervous system like acetaminophen, ibuprofen goes after these COX enzymes. They're responsible for producing prostaglandins, the chemicals that cause pain and inflammation.
So ibuprofen is like, nope, not going to let you make those pain chemicals in the first place.
A good way to put it, by blocking COX enzymes, ibuprofen reduces the amount of prostaglandins produced, which reduces both pain and inflammation.
Ah, so that's why ibuprofen is my go-to for a sprained ankle. It's tackling the root of the problem, not just masking the pain signals.
Exactly. It's about targeting the source of the issue. But it's worth noting that ibuprofen, while effective, does come with potential side effects, especially if used long term.
That's concerning. What kind of side effects are we talking about?
The most common are related to the gastrointestinal system. Long-term or high-dose ibuprofen use can increase the risk of ulcers or bleeding in the stomach and intestines. It's why it's always crucial to stick to the recommended dosage.
So ibuprofen is powerful, but it's not something to take lightly. It seems like there's some trade-offs to consider. What about this ketorolac? You mentioned it earlier. I honestly never even heard of it.
Ketorolac is a different beast altogether. It's also an NSAID, like ibuprofen, but significantly more potent. We often reserve it for more severe pain, particularly after surgery.
Wow, stronger than ibuprofen. Is it as strong as something like morphine?
It's a good question. Ketorolac can often provide pain relief comparable to opioids like morphine. But the important thing is it doesn't carry the same risks of addiction and respiratory depression.
So powerful pain relief without those serious opioid risks. That sounds almost too good to be true. What's the catch?
The catch is that it's only intended for short-term use, usually no more than 5 days. This is because it carries a higher risk of those same side effects we talked about with ibuprofen, especially for the stomach and kidneys.
So it's like a short-term heavy-duty solution for those really tough pain situations.
Exactly. It's a valuable tool, especially when we want to minimize the use of opioids. But it's not something you'd use for weeks on end for general aches and pains.
Okay, that makes sense. So we have our everyday options, acetaminophen and ibuprofen, and then ketorolac for those more extreme situations. But how do we know which one to choose when we're at home and feeling discomfort?
Well, like with many things in health, it depends, but let's break it down.
Perfect, because I think a lot of people listening are probably wondering the same thing.
If it's mild pain or a fever, acetaminophen is often a good place to start. It's generally considered safe when used as directed. But if you're dealing with inflammation, think like a sprained ankle or that kind of throbbing pain, ibuprofen might be a better choice. And of course, if the pain is severe or just doesn't seem to be getting better, it's always wise to talk to your doctor.
Okay, that helps. It's like having different tools for different jobs. But you mentioned earlier that long-term ibuprofen use can have some downsides. How common are those side effects? And are there certain people who should be extra cautious?
Yeah, that's a really important point to bring up. While most people can take ibuprofen without any issues, those potential gastrointestinal side effects are something to keep in mind, especially with long-term use. People with a history of ulcers or other stomach problems should definitely talk to their doctor before taking ibuprofen regularly.
Right. That makes sense. So it's not just about the type of pain, but also about your individual health history.
Absolutely. And it's not just past issues either. Things like what other medications you're taking can also come into play.
Ah, so there could be interactions to watch out for. That's a good reminder to always keep your doctor or pharmacist in the loop about everything you're taking. Speaking of which, dosage instructions can sometimes be a bit confusing. Any tips for navigating that?
You're not wrong. Those labels can be a bit overwhelming sometimes. The most important thing is to follow the recommended dosage on the label, or as advised by your doctor, don't exceed that maximum daily dose. Also be aware that a lot of those multi-symptom cold and flu remedies already contain acetaminophen, so factor that in to avoid accidentally taking too much.
Oh, that's a good point. I hadn't thought about those hidden sources of acetaminophen. So it's really about being mindful of everything you're putting into your body, even if it seems like an innocent over-the-counter remedy.
Exactly. And if you're ever unsure about anything, don't hesitate to ask your pharmacist. They're a wealth of knowledge about medications and can answer any questions you might have.
Yeah, pharmacists are definitely unsung heroes in the healthcare world. They deserve way more credit. So to recap, we've got our three pain relievers: acetaminophen for mild pain and fever, ibuprofen for pain with inflammation, and ketorolac for those short-term intense pain situations. We need to choose wisely based on the type of pain and our individual health situation. Follow dosage instructions carefully and always talk to a healthcare professional if we have any concerns.
Yeah, you summed it up perfectly. It's all about being informed and proactive when it comes to managing our pain.
Okay. I feel like we've covered a lot of ground here, but I'm curious, you mentioned earlier that the world of pain relief is constantly evolving. What are some of the emerging trends that have you excited about the future of pain management?
There's a lot happening right now. One area generating a lot of interest is personalized pain management.
Personalized pain management. That sounds incredibly futuristic.
It is. The idea is that pain is complex and influenced by many factors, from our genetics and lifestyle to even our psychological state. So a one-size-fits-all approach to pain relief isn't always the most effective.
Yeah, it makes sense. We're all unique individuals, so why should our approach to pain relief be any different? But how would this personalized approach actually work in practice?
Well, there are a few avenues being explored. For example, genetic testing could help determine how individuals metabolize different medications, allowing for more tailored dosages and choices. Another exciting area is the development of new drug delivery systems that target pain more directly and effectively.
So less of a take two aspirin and call me in the morning approach and more of a targeted, individualized strategy.
Exactly. It's about moving away from that blanket approach and embracing the complexity of pain.
That's fascinating. So it's like the future of pain relief is getting a personalized makeover. Are there other exciting developments on the horizon?
Definitely. There's also a growing focus on non-pharmacological approaches to pain management, like mindfulness, acupuncture, and physical therapy.
That makes a lot of sense. It's about treating the whole person, not just the symptoms.
Precisely. These therapies can be incredibly effective for certain types of pain and often work well in conjunction with medications.
So it's not about seeing medication as the enemy, but as one tool in a larger toolkit.
Exactly. And it's important to remember that sometimes the best medicine isn't a pill at all. It's about listening to your body making lifestyle changes and finding ways to manage stress and support overall well-being.
Such an important point. Pain is part of life, but it doesn't have to control our lives.
Yeah.
By exploring all our options and working with healthcare professionals, we can find ways to manage pain effectively and live our lives to the fullest.
Absolutely. It's about finding that balance between respecting pain as a signal and finding ways to manage it so it doesn't hold us back.
I love that. And speaking of respecting pain as a signal, something that's been on my mind throughout this discussion is the impact of having so many over-the-counter pain relievers readily available. Has this easy access changed our relationship with pain in a broader sense?
That's a really interesting question and something researchers have been looking into. The accessibility of these medications has undoubtedly influenced how we perceive and respond to pain.
It's like we've become a quick fix society. Headache, pop a pill, sore muscles. There's a cream for that. But are we losing something in the process? Are we becoming too quick to mask symptoms instead of addressing the underlying cause?
Yeah, it is a valid concern. Pain is a signal from our bodies trying to tell us something, and by constantly silencing that signal, we might be missing valuable information about what's really going on.
That makes me think about how we approach other areas of our lives. Are we applying that same quick fix mentality to things like stress, lack of sleep, or even relationship problems?
It's an interesting parallel. Have we become so accustomed to instant gratification and immediate relief that we've lost sight of the importance of addressing root causes?
Yeah, it's definitely something to ponder. So, how do we find that balance between respecting pain as a signal and managing it effectively so it doesn't take over our lives?
Well, I think it starts with awareness, being mindful of why we're experiencing pain and considering all of our options, not just reaching for medication as a first response. Could it be something as simple as needing more sleep, better posture, or changes to our diet?
Or maybe it's a sign that we need to slow down, incorporate more movement into our day, or simply give our bodies a chance to rest and recover.
Exactly. Sometimes the best medicine isn't a pill at all. It's about listening to our bodies and making the necessary changes to support our overall well-being.
That's such a powerful reminder. It's not about fearing pain or trying to eliminate it completely. It's about understanding it, respecting it, and working with our bodies to find relief and healing. And sometimes that means looking beyond the quick fix and addressing the underlying issues that might be contributing to our discomfort.
You've hit the nail on the head. Pain is a complex experience, and managing it effectively often requires a multifaceted approach. It's about understanding the tools at our disposal, both pharmacological and non-pharmacological, and knowing when and how to use them wisely.
Well, I think that's a perfect note to end on. We've explored the science behind these common pain relievers, delved into their potential benefits and risks, and even touched on some fascinating trends in pain management. But perhaps the biggest takeaway is this. Pain is a part of life, but it doesn't have to control our lives. By listening to our bodies, being informed about our options, and working closely with healthcare professionals, we can navigate the challenges of pain and find ways to live our lives to the fullest.
I couldn't agree more. It's about empowerment through knowledge, informed decision-making, and taking an active role in our own well-being.
A huge thank you to our expert for sharing their incredible insights and helping us demystify the world of pain relief. And to you, our listeners, thank you for joining us on this deep dive. We hope you've learned something new and feel empowered to make informed choices about your own health. Until next time, stay curious, stay informed, and as always, keep those brains buzzing.
All right. Looks like we've got quite the deep dive ahead of us today. Pain relief and antibiotics. Someone's been hitting the books hard,
Yeah, looks like 'em.
and they've organized all their notes like mini lectures.
Wow, that's
So we're going to help sort through it all and find the stuff that really matters.
great.
Whether you're studying for an exam or just trying to get your head around these topics.
Sounds good.
Let's start with pain relief.
Okay.
You've got your analgesics broken down into opioids, NSAIDs, and acetaminophen. Pretty standard, right?
Yeah. Classic for a reason, though.
Oh, for sure.
I mean, it all comes down to how these drugs actually work in the body
Makes sense.
and how those differences make a real impact when it comes to, like, actually using them.
Okay, so let's jump right into the deep end with opioids. You've got morphine, oxycodone,
Oh.
fentanyl in your notes.
Oh, yeah. Those are the...
Even specific doses written down, too. It's kind of crazy how a tiny dose of fentanyl can be as strong as a way bigger dose of morphine.
Yeah, that's why it's so carefully used,
Makes.
like in anesthesia and for really bad pain.
Speaking of which, you've even got a note about naloxone,
Oh, right.
that opioid overdose reversal agent. It's like a safety net with these powerful drugs. Right?
Exactly.
Yeah.
Especially when breathing gets really slow or even stops.
Scary stuff.
Yeah, having it on hand is crucial for anyone who prescribes or gives opioids.
Okay, let's move on from the heavy hitters. You've also got a section on NSAIDs, ibuprofen, naproxen, aspirin.
Yeah, these are the ones everyone knows.
Yeah, the ones we read for when we get a headache or our muscles are sore.
Totally.
But you've also got a note here highlighting COX-1 and COX-2 enzymes. What's that all about?
Oh, that's a key difference. It explains why some NSAIDs are easier on the stomach.
Oh, so like if a patient has a history of ulcers,
Right.
choosing a COX-2 selective NSAI would be safer?
Exactly. COX-1 protects the stomach lining,
Ah,
so blocking it can lead to more ulcers and bleeding.
I-
COX-2, though, that's mostly about inflammation. So an NSAID that focuses on just COX-2 can offer pain relief and reduce inflammation with way less risk of those stomach problems.
now aspirin seems a little different.
Yeah.
You've got a note about it preventing heart attacks and strokes,
Right.
which is kind of surprising given the risks of NSAIDs.
Aspirin's special because it stops COX enzymes permanently, especially in platelets.
Oh, wow.
By stopping platelets from clumping together, a low dose of aspirin can lower the risk of those blood clots that cause heart attacks and strokes.
So it's really interesting, a
Yeah.
tiny tablet with a big impact.
Yeah.
Let's not forget about acetaminophen, though.
Right, the go-to for fever and mild pain.
Yeah. And you've even flagged the maximum daily doses, highlighting that liver damage risk with overdoses.
Yeah, people think it's totally harmless because it's everywhere.
Right.
But going over that dose, especially with alcohol, can really hurt the liver.
So no mixing those two.
Definitely not.
Huh.
Both are processed by the liver, and together, it's just too much.
Makes sense. Speaking of complications, that leads us to antibiotics. You've got a whole section on them categorized by class, almost like a cheat sheet for pharmacology.
Nice.
Understanding these classes is key, right?
Oh, absolutely.
Because each one attacks bacteria differently, and we all know antibiotic resistance is a growing problem.
Yeah, choosing the right antibiotic for the right infection is huge.
Okay, well, let's dive into the world of these bacteria fighters. First up, penicillins.
The classic.
Yeah, you even have amoxicillin, which is used for so many things, ear infections, UTIs, the list goes on.
Penicillins changed everything in medicine.
For sure.
And they're still so valuable, they basically make the bacteria explode.
Wow.
Amoxicillin is definitely a workhorse, but we always got to watch out for allergic reactions.
Okay, so effective, but watch out for allergies. Got it.
What about cephalosporins? You've got ceftriaxone and cefazolin highlighted.
Oh, yeah?
Are those like penicillin's cousins or something?
Kinda. They work in similar ways.
Okay.
They also target the bacterial cell wall.
But cephalosporins usually work against a wider range of bacteria.
So they're like penicillins, but stronger.
You could say that. And they come in different generations, with later ones being even more powerful.
Cool.
Like cefazolin is often used before surgery to prevent infections.
Ah, like a pre-op bodyguard.
Exactly. And ceftriaxone is used for more serious stuff like meningitis.
So cefazolin, the bodyguard, and ceftriaxone, the heavy hitter.
I like that.
But what about people who can't handle penicillins or cephalosporins? Like, because of allergies?
That's where macrolides come in. They work in a totally different way by stopping the bacteria from making proteins.
Clever.
You've got azithromycin and erythromycin highlighted.
Oh, yeah.
Those are usually prescribed for respiratory infections and a bunch of other things.
Now, you also have a note about macrolides messing with heart rhythm.
Oh, right. Yeah.
What's up with that?
So they can mess with the heart's electrical activity in some people,
Oh.
especially those with existing heart problems. So it's really important to check a patient's medical history before prescribing them.
So macrolides stop protein production, but have that potential heart rhythm issue.
Got it. Now for the really powerful ones, fluoroquinolones, you've got ciprofloxacin and levofloxacin.
Yeah, I know those.
I've definitely heard those names before.
Fluoroquinolones are strong antibiotics that stop bacteria from replicating their DNA.
Wow, that's intense.
Yeah, they work against a lot of different infections, but can have some rough side effects.
You even have tendon rupture and nerve damage highlighted.
Yeah, those are serious.
No kidding.
That's why they're usually safe for the really tough infections when other antibiotics haven't worked.
Makes sense.
You gotta weigh the benefits and risks,
For sure. Last category, tetracyclines.
including doxycycline.
These seem to be used for everything from acne to Lyme disease.
They also stop protein synthesis in bacteria,
Okay.
but they work against a broad range of infections, hence the variety.
You've got a big warning about tooth discoloration in kids, though.
Yeah, that's a big one. Definitely don't want to mess with that.
Yeah, tetracyclines can bind to calcium in developing teeth and cause permanent staining.
That's why they're not used in kids under 8 or during pregnancy, right?
Exactly.
So tetracyclines are the versatile protein synthesis stoppers, but watch out for those teeth. Okay, that's all the major types of pain relievers and antibiotics.
You've clearly done a lot of research and organized everything to highlight the key differences.
You've been taking great notes, and it's all about understanding those nuances,
It really is.
especially for anyone in healthcare.
For sure.
Yeah.
We've covered a lot of ground here, but we're not done yet. There's always more to learn, and with antibiotic resistance growing, we need to be careful about how we use these drugs.
Totally agree.
But let's take a quick breather and then dive into some cases from your notes and see how all this theory plays out in the real world.
Sounds good to me.
All right, let's do it.
Awesome. All right, ready to put all this knowledge to the test.
Oh, yeah. Bring on the case studies.
Yeah,
I always love a good medical
I
mystery.
bet you do. Plus, it helps to see how this all works in real life.
Exactly. So let's start with Mr. Jones.
Right.
A 65-year-old man with osteoarthritis.
Okay.
He just had a knee replacement.
Oh, wow.
You've got his post-op pain management plan highlighted,
Yeah.
and it's a perfect example of multimodal analgesia.
Multimodal analgesia. That sounds kind of fancy.
It is.
But looking at his plan, it makes sense.
Yeah?
He's got a mix of meds, an opioid for when the pain breaks through,
Right.
an NSAID for inflammation, even acetaminophen for fever and pain.
It's a smart approach.
Yeah,
It tackles the pain from different angles.
like a pain relief symphony or something.
I like it.
But I see you've also flagged a concern.
Oh, yeah.
Mr. Jones has a history of peptic ulcer disease.
Mm-hmm.
That's gotta be a red flag with the NSAID, right?
Big time. A KOX2 selective NSAID would be better here.
Oh, okay.
Or even a short course of a proton pump inhibitor along with a regular NSAID.
To protect his stomach.
Yeah.
That's a great example of how you have to think about each patient individually. Speaking of which, you've also got a note about watching his kidney function while he's on the NSAID.
Oh, yeah, that's important.
Why is that?
NSAIDs can affect the kidneys,
Oh.
especially in older folks or people with existing kidney problems.
Oh, got it.
So we got to keep an eye on things.
Okay, so we've got Mr. Jones' pain under control.
Hopefully.
Let's move on to a case with antibiotics.
Good idea.
A 30-year-old woman, let's say Miss Smith,
Right.
who has all the classic signs of a UTI.
Oh, yeah, common one.
But you've highlighted getting a urine culture before starting antibiotics.
I was going to make sure.
Why bother, though, if it seems so obvious? Can't we just start her on a standard UTI antibiotic?
I know it's tempting,
Yeah.
but the culture tells us exactly what bacteria is causing the problem and how sensitive it is to different antibiotics.
So we're not just guessing.
Nope, we want to be precise.
You've also mentioned a single-dose antibiotic for Miss Smith.
Yeah.
Tell me more about that.
So for uncomplicated UTIs, a single big dose can be as effective as taking it for a week.
Really?
Yeah.
That's amazing.
It means less exposure to the antibiotic overall,
I see.
fewer side effects, and less risk of resistance developing.
So less is more in this case.
You got it.
But what if she had a more complicated UTI?
Oh, like with fever or signs of kidney problems.
Yeah, exactly.
Then we'd need a longer course and maybe a broader spectrum antibiotic.
To really knock it out.
Yeah,
All right, so it all depends on the patient and what's going on.
always.
Now, for a case that really shows how tough antibiotic resistance can be,
Okay, let's hear it.
a 70-year-old man, Mr. Brown, hospitalized with pneumonia,
Mm-hmm.
but the first antibiotics didn't work.
Oh, that's not
A
good.
sputum culture showed MRSA.
That's a tough one.
How do you even treat that?
MRSA needs special antibiotics, usually vancomycin,
Okay,
but there are others like linezolid or daptomycin depending on the specific MRSA strain.
so we're bringing in the heavy artillery.
For sure.
What about preventing these resistant infections in the first place? What can we do?
That's the big question. It takes a multifaceted approach.
Yeah.
You gotta be careful with antibiotics.
So no more antibiotics for every little cold.
Exactly.
Yeah.
And patients need to finish the whole course even if they feel better.
Yeah, I've heard that before.
And of course, basic infection prevention like hand washing and vaccines are huge.
To stop the spread.
Exactly. Less infections mean less need for antibiotics, which means less resistance.
These cases really show how it all works in real life.
Yeah, it all comes together.
How the patient's situation, the specific bug, and antibiotic resistance all matter when making treatment decisions.
It's like a chess game,
Yeah.
Every move has
Yeah.
consequences.
What's amazing is how much we've learned about these drugs over time.
Yeah, our knowledge is always growing.
Speaking of which, you've highlighted this idea of pharmacogenetics.
Ah, yes. The future of medicine.
What is that exactly?
It's how our genes affect how we respond to drugs.
So how can our genes affect how we handle pain relievers or antibiotics?
Well, our genes control how our bodies break down and use medications, right? Some people might metabolize certain drugs slower or faster than others.
I see.
That's why some people don't get relief and others have more side effects.
So could we one day choose medications based on someone's genes?
That's the goal. For example, we could use genetic testing to find people who are more likely to have bad reactions to certain drugs.
Wow, that's amazing.
Then we could give them different meds or adjust the dose to keep them safe.
So it's like personalized medicine.
It is. And it's growing fast. We're already using it for some drugs.
Wow.
And it's only going to get bigger.
That's pretty exciting. To think we could personalize pain relief and antibiotic treatment based on your genes?
Yeah, it's incredible.
But let's not get ahead of ourselves.
Right back to the present.
Even with all this knowledge,
Yeah.
the most important thing is to use it wisely and treat each patient as an individual.
Couldn't agree more.
Okay, so we've explored pain relievers and antibiotics, looked at real-world cases, and even peeked into the future with pharmacogenetics. It's amazing how much ground we covered.
It really is.
I feel like I just went through a whole semester of pharmacology.
Oh, I know, right.
But I don't feel overwhelmed. I actually feel energized.
I get that.
Seeing how it all connects, like how the drug classes work and how that actually plays out in real patients.
Yeah, that's what brings it all together.
It really does.
It's not just memorizing facts.
Right.
It's about seeing the bigger picture.
Exactly.
And that picture just gets more and more detailed the more you learn.
What really struck me was how complicated pain management and antibiotic therapy can be.
Oh, yeah, for sure.
There's no one right answer for everything.
Nope.
And every decision we make can impact things.
Yeah.
Not just for that one patient,
Right.
but for everyone.
It's humbling, isn't it?
Yeah, it really is.
It makes you realize we got to keep learning.
For sure.
Stay curious and not be afraid to admit when we don't know something.
That's so true. Looking back at everything we've talked about,
Yeah.
all the different drugs, how they work, those case studies, even pharmacogenetics, I'm starting to see patterns.
That's how you become an expert.
It's like you can see the whole forest now, not just individual trees.
Exactly.
You can spot potential issues before they even happen.
And make good decisions even when things are uncertain.
I remember feeling so intimidated when I started learning about these drugs.
Oh, yeah. It's a lot to take in.
But now it feels more like a puzzle.
I like that analogy.
And I'm starting to figure out how the pieces fit.
And the more pieces you fit, the clearer the picture gets.
Exactly.
But the best part is there are always more pieces to find.
Yeah, you never stop learning.
Exactly.
So as I keep learning about all of this, what's the most important thing to remember?
Never stop asking questions.
Okay.
Never stop learning.
Mm-hmm.
And don't underestimate the power of critical thinking.
Because in medicine, knowledge is power.
It is.
The power to heal and to make a difference.
Well said. I think we've reached the end of our deep dive.
We have. It's been amazing.
I've enjoyed it.
Thanks for guiding me through this complicated world of pain relief and antibiotics.
It's my pleasure. And remember, the journey doesn't end here.
So true.
Keep exploring, keep questioning. There's always something new to discover.
Well said. And to everyone listening, thanks for joining us on this deep dive. We'll see you next time.
Welcome back, everybody, to the deep dive. Ready to explore some more with me today?
Always.
Awesome. All right, so today we're going to take a look at a couple of medications that pretty much everybody has heard of, at least.
Right.
I mean, aspirin, nitroglycerin, so common, but also
Yeah.
kind of interesting when you start to dig deeper, right?
Yeah, absolutely. I mean, even those common, everyday, over-the-counter things, there's a lot going on there.
Totally. So we've got some excerpts here from some medical summaries
Okay.
to guide us. And what we're going to do is really kind of try to get down to, how do these things actually work in your body?
Right.
What are they used for?
Yeah.
And really, why should you care?
Yeah.
Why does this matter to you as a person you know?
Absolutely.
Okay, so let's start with aspirin. I think that's probably the one most people are familiar with, right?
Sure.
You get a headache, you get a fever, that's what you reach for. But it also does all these other things.
Yeah.
It's an anti-inflammatory. It helps prevent heart attacks and strokes.
I got a busy
How does one little pill do all of that?
It really is.
Mm-hmm.
So the basic way that aspirin works is by blocking these chemical messengers in your body that trigger pain and swelling.
Yeah.
So if you think about it, if you get a cut, your body sends out these messengers. They're called prostaglandins.
Prostaglandins.
Yeah, it's a mouthful.
Yeah.
But these prostaglandins, they start this cascade of events that,
Yeah.
help your body heal, but sometimes they can go a little overboard. They can cause too much pain, too much inflammation.
So they're like the drama queen of your body.
Yes,
Okay.
exactly.
Right.
A little over the top, and that's where aspirin steps in, kind of intercepts those messengers.
So aspirin is like the bouncer at the club, all right, everybody calm down.
Exactly. Everybody take it down a notch.
Okay.
Now, this is where it gets really interesting because aspirin also affects your blood in particular. It prevents platelets from clumping together. Platelets are responsible for blood clotting, which, when you have a cut, that's a good thing.
Right.
But when it happens inside your blood vessels,
Not so much.
not so good. That's actually what can cause heart attacks and strokes.
Okay.
So aspirin's ability to prevent these clots is really what makes it so effective in protecting your heart.
That makes sense. But if it's preventing clots, then doesn't that mean, if you get a cut, you're just going to bleed forever?
That's a great question. And it is something to be aware of because aspirin's effect on platelets actually lasts a surprisingly long time. We're talking 7 to 10 days.
Wow.
So it's not just like an immediate thing. So this is why understanding the dosage is crucial.
So there's a difference between taking like an aspirin for a headache and taking an aspirin to like protect your heart.
Absolutely. The standard dose for pain relief is much higher than the low dose that's used for preventing those blood clots.
Okay.
It's a delicate balance.
Gotcha.
And that brings us to some of the risks associated with aspirin because,
Yeah, because I always hear about aspirin and like stomach problems.
Right.
Is that a real thing?
It is definitely a real thing. Aspirin can irritate the stomach lining. It can potentially lead to ulcers,
Oh, wow.
even bleeding, especially if you're using it long term.
Okay.
And there's also a rare but serious risk specifically for children. It's called Ray's syndrome. Have you heard of that?
I've heard of it, but I don't really know what it is.
So this can cause serious liver and brain damage in kids who take aspirin when they have viral infections, like the flu or chickenpox.
Oh, God.
So generally, aspirin is off limits for anyone under 18. It's just not worth the risk.
So that's like a hard and fast rule.
Pretty much.
Yeah.
There might be some very specific exceptions, but in general,
Okay.
aspirin is a powerful tool. But like any tool, it needs to be used responsibly with a clear understanding of both its benefits and its risks.
All right. So there's a lot to think about when it comes to aspirin.
There is.
Let's switch gears a little bit and talk about nitroglycerin. So I know that it's used for chest pain, but like, how does it actually work?
So nitroglycerin, this is a fascinating one. It's primarily used to treat angina, which is that chest pain that's caused by reduced blood flow to the heart.
Okay.
You can think of it like this. Imagine your blood vessels are like highways,
Okay.
right? And when you have angina, it's like there's a traffic jam preventing blood from reaching your heart.
Oh, so nitroglycerin is like the guys that come and clear the accident so the traffic can start flowing again.
Exactly. It clears the traffic jam.
Okay.
And the way it does that is it's a very potent vasodilator, which means it relaxes and widens those blood vessel highways.
Okay.
So it allows more blood to get through to reach your heart muscle and relieve that pain.
Now, I've seen those little pills that people put under their tongue for chest pain. Is that nitroglycerin?
That's right. That's the sublingual form of nitroglycerin, and it's designed for fast relief during an angina attack.
Oh.
The effects kick in within minutes, which is crucial when you're experiencing chest pain. And then you also have patches, which are used for more long-term management.
Okay.
They release the medication slowly throughout the day.
So it's like, sublingual for the immediate crisis and then the patches for like the ongoing, like, prevention type of thing.
Yeah.
Cool. Now, what about side effects? I imagine there's got to be some side effects with something as powerful as nitroglycerin.
You're absolutely right. There are side effects to consider, and one of the most common is headaches.
Oh, really?
And ironically, it's caused by the same vasodilation that's relieving the chest pain.
So you're saying the thing that's helping your heart is giving you a headache.
It can, yeah.
That's rough.
When those blood vessels widen in your head, it can create kind of a throbbing sensation.
So it's a trade-off.
It can be, yeah.
Anything else we should know about kind of the downsides of nitroglycerin?
This is where it gets interesting. If you use nitroglycerin too frequently, your body can actually start to develop a tolerance to it, meaning it becomes less effective over time.
Oh, so more isn't always better.
Not necessarily.
Okay.
Especially with those long-acting patches, doctors will often recommend what's called a nitrate-free interval.
A nitrate-free interval.
Yeah, where you actually remove the patch for a period each day just to help maintain the medication's effectiveness.
Okay. So it's all about finding that balance, right?
Yeah.
Listening to your doctor's instructions.
Exactly.
Okay.
Okay.
So we've covered a lot of ground here, from how aspirin works to, the different forms of nitroglycerin.
Yeah.
It's really kind of eye-opening how even these medications that seem so simple on the surface actually have like all these complex mechanisms and effects on your body.
Yeah, it really highlights how much is going on.
Yeah, it really does make you realize that there's more to these medications than meets the eye.
Absolutely. Yeah, for sure. I mean, it just goes to show you, even these common medications, like it's worth taking the time to really understand them.
Totally. So, I mean, let's be honest. Trying to keep up with all the medical information out there it can be overwhelming.
Absolutely.
So what would you say, like, what's the biggest takeaway here?
I think the most important thing is that knowledge is power when it comes to your health.
Okay.
Understanding how these medications work, what they're used for, their potential risks, it just empowers you to make more informed decisions.
Yeah.
And it lets you have more productive conversations with your doctor.
That's such a good point. I mean, you're not just like passively taking a pill.
Right.
You're like an active participant in your healthcare.
Exactly. Imagine you're experiencing chest pain and you call your doctor. Being able to explain what type of nitroglycerin you took, how much you took it, how long ago you took it,
Hmm.
like that can make a big difference in their assessment.
Or let's say you're thinking about taking an aspirin for a headache, but you also have like a really sensitive stomach.
Yeah.
Knowing those risks might make you pause.
Mm-hmm.
Consider other options, or at least talk to your doctor first.
Exactly. And if you're taking low-dose aspirin for heart health, it's really important to tell your doctor about any other medications you're on,
Okay.
especially ones that could increase your risk of bleeding.
So it's all about being proactive and informed,
Mm-hmm.
but not about like self-diagnosing or anything like that.
Right.
It's about understanding the tools and using them wisely.
Exactly. Working with your doctor.
Yeah, in consultation with your doctor.
Absolutely.
Okay, great. So we've talked about how aspirin prevents blood clots. Nitroglycerin
Mm.
opens up the blood vessels.
Yeah, it's amazing what these little pills can do.
Right. Now, knowing that, how might this information like change the way you think about your own health choices or those conversations with your doctor?
Ooh, that's a great question to think about.
Right. Like, does it make you think about these medications differently or even maybe spark some curiosity to learn more?
I hope so. I think that's the goal.
I love that. So never stop learning, never stop asking questions.
Absolutely. It really is. And it kind of makes you think, what else is out there? What other medications are we taking without really understanding them?
Exactly.
Yeah.
And that's really, I think, what this whole deep dive is all about,
Yeah.
giving you the knowledge to kind of be an active participant in your
Absolutely.
own health journey.
It's your body.
Yeah,
You should know what's going on.
exactly. So it's been awesome diving deep into this with you.
Likewise.
Really appreciate your expertise.
Happy to be here.
And of course, a huge thanks to you, our listeners, for joining us on this exploration of aspirin and nitroglycerin. Remember, knowledge is power when it comes to your health.
Couldn't agree more.
So keep asking those questions, keep learning, and keep those conversations going with your doctor. Until next time, stay curious.
Welcome to our deep dive today. We're going to be like emergency medication detectives.
Oh, I like that.
We're going to be cracking the code on 3 common emergency meds:
Okay.
epinephrine, salbutamol,
Mm-hmm.
and dexamethasone.
Sounds good.
By the end, you'll know exactly what they do and why they matter.
Absolutely.
So are you ready to dive in?
Let's do it. Those medications are true lifesavers, but
Yeah.
they're not your average over-the-counter pills.
Right, exactly. Okay, so first up,
Okay.
epinephrine. I've always heard it called the fight or flight drug,
Hmm.
but I've always wondered, about all the different ways you can give it, like with an EpiPen or in a hospital. What's the big deal about that?
Well, it all boils down to concentration.
Okay.
It's kind of like, how a little spice can add a kick to a dish,
Yeah.
but if you use too much,
Yeah.
it can totally overwhelm the flavors.
Total.
So EpiPens, you might have seen them in schools or restaurants. Those have a 1.1000 concentration for intramuscular injection, meaning it goes straight to the muscle.
Oh.
But in a hospital setting, we often use a 1.10,000 concentration for IV administration directly into the bloodstream.
Wow, that's a much bigger difference than I thought.
Yeah, and getting that ratio wrong can have serious consequences.
Makes sense. But either way, it seems like epinephrine is working on multiple systems in the body, right?
You got it. Epinephrine acts on what we call adrenergic receptors. Think of them like locks, and epinephrine is the key.
Okay.
When it binds to alpha-1 receptors, it's like making your blood vessels squeeze tighter, which increases blood pressure.
Got it.
And then when it hits those beta-1 receptors in the heart, it's like putting your heart on overdrive. Your heart rate speeds up and pumps harder.
So it's like supercharging the heart and blood vessels.
Exactly.
But I know it's also used to help people breathe during allergic reactions.
Right. That's where the beta-2 receptors come in.
Ah,
They're mostly found in the lungs.
okay.
And when epinephrine binds to them, it causes the airways to relax and open up, which we call bronchodilation.
Right. Okay.
It's like taking a deep breath after being underwater.
So it's a multitasker, but that must also mean it comes with some risks, right?
Of course. You have to use this medication really cautiously.
Yeah.
Even when it's given correctly, you can see side effects like anxiety, tremors,
Mm-hmm.
and more seriously, it can cause dangerously high blood pressure, irregular heartbeat,
Oh, wow.
even fluid buildup in the lungs. So careful monitoring is super important, especially after giving epinephrine.
It sounds like epinephrine is like a powerful tool that requires a skilled hand.
Yes, Definitely.
Okay, so what about salbutamol? I know
Uh,
that's usually used for asthma. So how does
What?
it fit into all of this?
Well, salbutamol, also known as albuterol,
Right.
is like epinephrine's more focused cousin.
Okay.
Epinephrine acts on a bunch of different receptor types,
Uh-huh.
but salbutamol mainly targets those beta-2 receptors in the lungs.
Oh, I see.
Think of your airways like tight rubber bands. Salbutamol helps relax those bands,
Yeah.
makes it easier for air to flow through.
So it's a more targeted approach to opening up those airways.
Exactly. And that's why it's so commonly used for treating asthma attacks
Mhm.
and COPD exacerbations.
Got it.
Plus, it works quickly. Those rescue inhalers you see,
Yeah.
those provide relief within minutes.
That's got to be reassuring for someone who's struggling to breathe.
Yeah, for sure.
But I've also heard that using inhalers too much can be a problem.
That's true.
Yeah.
It's important to remember that salbutamol is meant for quick relief,
Okay.
not long-term control.
Mm.
And while it's generally safer than epinephrine,
Yeah.
overuse can lead to tremors, a rapid heartbeat, headaches,
Oh, wow.
and even electrolyte imbalances.
That's a lot.
Yeah,
So I'm starting to see why understanding those nuances is so important.
absolutely.
Okay, so we've talked about medications that act pretty quickly.
Right.
Now let's switch gears to dexamethasone, which I know is used for a whole bunch of conditions from inflammation to allergies. What makes it so different from epinephrine and salbutamol?
Well, dexamethasone is in a completely different class.
Okay.
It's a corticosteroid, which means it acts on the immune system
Okay.
to reduce inflammation and suppress the immune response.
So it's a powerful tool.
It is. You might have heard of a similar medication called prednisone.
I have, yeah.
They work in very similar ways.
It seems like it's used for everything, like allergies and even more serious conditions like autoimmune diseases.
That's right.
Wow.
Dexamethasone is incredibly versatile.
Yeah.
We use it to treat all sorts of things, from severe asthma and COPD to inflammatory bowel disease,
Oh, wow.
and even some types of cancers.
Wow, that's a huge range.
Yeah, the reason it's so effective for so many different conditions is that it tackles inflammation at
Source.
the immune response.
That makes sense.
Yeah.
But suppressing the immune system must come with some downsides, right?
You're right. Dexamethasone's potent effects
Yeah.
do come with some risks,
Yeah.
especially with long-term use. It can suppress your adrenal glands,
Oh, wow.
which produce essential hormones like cortisol.
Right.
Long-term use can also lead to bone thinning, increase the risk of infections, even some serious psychiatric effects.
Okay, so it's not a medication to be taken lightly.
No, definitely not.
What stands out to you as the most important thing for people to know about dexamethasone?
I think the biggest takeaway is that while it can be a lifesaver in many situations, it needs to be used cautiously and under the guidance of a healthcare professional.
Okay.
We always aim for the lowest effective dose
Right.
and taper it off gradually to minimize those risks.
So it sounds like all three of these medications are powerful tools, but like any tool, they need to be used correctly.
Absolutely.
Okay, so we've covered a lot so far.
We have.
From understanding how they work to recognizing their potential benefits and risks. Before we go any further, is there anything else you think is important for people to keep in mind about these emergency medications?
You know, I think it's really important to remember that each medication has its own, you could say, personality.
Personality, okay.
Epinephrine is like that quick-acting hero jumping in to save the day in emergencies.
Right.
Salbutamol is the focused specialist targeting the airways for rapid relief.
Okay.
And dexamethasone is the steady, long-term strategist tackling inflammation and suppressing the immune response.
I like that analogy. It really brings their different roles to life.
Yeah.
But it seems like they can also work together, right?
Exactly. They do.
It's not always just using one medication in isolation.
No, always. No.
Okay, cool.
Understanding how these medications can complement each other for the best patient care.
Right.
That's a crucial aspect of emergency medicine.
Wow, that's so fascinating.
Yeah,
It seems like we've only just scratched the surface.
I think so.
Let's take a moment to reflect.
Okay.
What surprised you the most about these medications so far?
You know, what really struck me is just how much misinformation is out there about these commonly used medications. It really highlights the importance of having reliable sources of information and not just relying on like hearsay or Dr. Google you know?
I totally agree.
Yeah,
It's
yeah.
so easy to get caught up in all the hype or misinformation, especially when it comes to our health.
Yeah,
So, to all our listeners out there, remember to always consult with your healthcare provider for advice.
absolutely.
Don't self-medicate or rely on info from questionable sources.
Yeah, your health is too precious to gamble with.
Okay, so are you ready to unpack even more about these fascinating medications?
I am. Let's go.
We're going to delve into their specific uses,
Okay.
how they're administered, and what to watch out for in different situations.
Sounds good. Let's talk about how quickly these medications actually kick in.
Okay.
Because that's super important in emergencies, right?
Yeah, I bet every second counts when someone's having like a severe allergic reaction or a heart attack.
Oh, absolutely. Like with epinephrine, for example.
Yeah.
It has almost an immediate onset when it's given intravenously. That's why it's so vital in those really critical situations.
Okay, that makes sense.
Yeah.
I've used those like nasal decongestant sprays
Yeah.
that have epinephrine in them,
Right.
and those seem to work pretty quickly too.
They do, yeah. Even when it's administered intramuscularly, like with an EpiPen, or even through the mucous membranes like a nasal spray, epinephrine starts working within minutes.
Oh, yeah.
Salbutamol, when inhaled, is also pretty fast-acting.
So epinephrine and salbutamol are like the first responders,
Exactly.
providing that quick relief.
Yeah.
What about dexamethasone, though? It
Yeah.
seems like it takes a while to, work its magic.
It does, yeah.
Yeah.
Dexamethasone can actually take hours to have a noticeable effect,
Really?
and its full impact might not be seen for a day or two.
Oh, wow.
But here's the interesting part.
Okay.
While epinephrine and salbutamol wear off relatively quickly, the effects of dexamethasone can last for days.
So it's more like the long-term support.
Exactly.
Got it.
We often use dexamethasone to get inflammation under control,
Mm-hmm.
and then we'll transition to other medications for long-term management.
Okay.
It's kind of like putting on a fire, right? You
Yeah.
need something quick and powerful like epinephrine or salbutamol to really knock down those flames initially. But then you need something like dexamethasone to make sure those embers don't reignite.
I remember taking prednisone once,
Oh, yeah.
which you mentioned is similar to dexamethasone for like a really bad allergic reaction.
Yeah.
And it definitely took a few hours to feel any relief, but the effects lasted for a couple of days.
Exactly. That's a perfect example of how corticosteroids work differently
Okay.
compared to epinephrine or salbutamol.
Yeah.
They're not about that immediate right-away response,
Right.
but more about controlling that underlying inflammation.
I think this deep dive is really highlighting the importance of understanding those differences.
Absolutely.
Not just for healthcare professionals,
Yeah.
but for, everyone.
I couldn't agree more. It's all about empowering people to be informed about the medications that they might, encounter in their own lives or the lives of, their loved ones.
Right.
So they can make informed decisions.
So far, we focused on these serious emergency uses for these medications. But are there any more everyday uses that people might not know about?
Yeah, actually there are. You mentioned those nasal decongestant sprays earlier.
Yeah.
Those use epinephrine.
Oh,
And it's also commonly used in local anesthetics at the dentist's office.
really?
Yeah, it helps to constrict those blood vessels,
Wow.
which keeps the anesthetic localized
Okay.
and makes it last longer.
I had no idea.
Yeah.
It's amazing how these medications we think of as these,
Yeah.
emergency drugs
Yeah.
have all these other applications.
They do, yeah.
What about salbutamol? Any surprises there?
Well, apart from its use in asthma and COPD,
Yeah.
salbutamol can actually be used to treat high potassium levels.
Oh, wow.
It's called hyperkalemia,
Okay.
and it essentially helps shift potassium from the blood into the cells,
Okay.
which can be a lifesaver in certain situations.
Okay, so another really important use,
Yeah.
and dexamethasone.
Yeah.
I know it's used for a lot of inflammatory conditions, but are there any kind of less common uses?
There are. Dexamethasone can also be used to treat some types of nausea and vomiting,
Oh, wow.
particularly those associated with chemotherapy.
Oh, okay.
And in some cases, it's even used to help stimulate appetite
Really?
in patients who've lost their appetite due to illness.
Wow. That's a lot of different uses.
It is, yeah.
It sounds like dexamethasone is the ultimate multi-tool.
It is very versatile,
Yeah.
but again, it's so important to remember that its potent effects come with potential risks.
Right.
It's always about carefully considering those benefits and risks and using it, with caution.
Speaking of risks, I'm curious, what are some of the common misconceptions that you encounter about these medications?
Ooh, that's a good question. One of the biggest misconceptions I hear is that epinephrine is like a cure-all for allergic reactions.
Okay.
Now, while it can be life-saving in anaphylaxis,
Yeah.
it's not a substitute for seeking immediate medical attention.
Right.
It's crucial to remember that epinephrine really just buys you time.
Yeah.
It's not a permanent solution.
It's easy to think that,
Yeah.
like, okay, I gave the epinephrine,
Right.
the danger is over,
Exactly.
but that's not always the case.
Not always, no.
And with salbutamol,
Yeah.
a common misconception I've heard is that you can use your inhaler, like, as much as you need without any consequences.
Oh, yeah, I hear that one a lot.
Yeah.
And, I mean, I understand when
Yes.
someone's having an asthma attack, they might panic.
Yeah.
Just want to keep using the inhaler.
Yeah.
But, as we talked about earlier, overuse can lead to a bunch of problems,
Yeah.
including that paradoxical effect of actually making the bronchospasm worse.
Right. Right.
What about dexamethasone?
Yeah. Are there any misconceptions about that one that stand out to you?
Yeah, I often encounter the belief that dexamethasone is completely safe
Okay.
because it's a steroid that's naturally produced by our bodies.
Oh, right. Yeah.
Now, while it is true that our bodies produce corticosteroids,
Mm.
the doses that we give as medication are way higher
Right.
and can lead to all those side effects that we talked about.
It seems like knowledge is truly the best medicine.
You got it, absolutely.
Yeah.
The more we understand how these medications work, their potential benefits and risks,
Mm-hmm.
the better equipped we are to use them safely and effectively.
Right.
And that goes for healthcare providers
Yeah.
and the general public.
I'm curious, from your perspective,
Yeah.
what's been the most rewarding part of this deep dive so far?
You know, I think it's been shedding light on these commonly used medications
Mm-hmm.
that people might not fully understand
Yeah.
by taking these like really complex concepts
Yeah.
and breaking them down into more relatable terms.
Right.
We're empowering people to take more control of their health
Mm-hmm.
and advocate for themselves.
Exactly.
And that, I think, is really rewarding.
I agree. It's been so fascinating to go beyond just the surface level and really like dig deep into these emergency medications.
Absolutely.
But before we wrap up, I want to go back to something you mentioned earlier
Yeah.
about reliable information.
Right.
With so much misinformation online these days,
Oh, totally.
it can be really tough to know which sources to trust.
It can.
Yeah.
It's overwhelming.
Do you have any tips for our listeners on how to navigate that confusing landscape?
That's a great question. I always recommend sticking to really reputable sources like government health websites,
Okay.
professional medical organizations, educational institutions,
Okay.
those kinds of places.
Hmm.
Be wary of information that just sounds too good to be true
Right.
or that promotes like miracle cures or dismisses conventional medical advice.
Yeah. Yeah.
And always, always, always consult with your doctor or pharmacist for, personalized advice.
Yeah.
They are your absolute best resources for accurate and trustworthy information.
That's excellent advice. And remember,
Yeah.
just because something is like popular or trending online
Yeah.
doesn't mean it's actually true or even safe.
You're absolutely right. You have to really think critically, question what you see and hear out there, especially when it comes to your health.
So we've explored how these medications work,
Yeah.
their various uses, their benefits, risks, and even some common misconceptions.
Mm-hmm.
But I think there's one more crucial aspect that we need to cover,
Okay.
how they're actually administered
Okay.
and what to watch out for in different situations.
Right.
Are you ready for that final deep dive?
Let's do it. Let's equip our listeners with that practical knowledge they need
Yes.
to navigate these medications safely and confidently.
Perfect. Okay, let's talk about how these medications are actually given, because I imagine there's a big difference between using an EpiPen and like getting an injection in a hospital, right?
Yeah. Oh, absolutely. The way it's administered, the route of administration plays a huge role in how fast and how well a medication actually works.
Right.
Like, take epinephrine, for example.
Yeah.
In a real emergency, like anaphylaxis,
Yeah.
every second matters.
Right.
That's why EpiPens are designed for intramuscular injection.
Okay.
They deliver the medication right into a large muscle, like your thigh, which lets it enter the bloodstream super quickly.
That makes sense.
Yeah.
I've also heard of epinephrine being used in hospitals for cardiac arrest.
Yeah.
Is that given the same way?
For cardiac arrest, we usually give it intravenously
Oh.
because it needs to get to the heart ASAP.
Right. Right.
This allows for really precise dosing and more controlled delivery,
Okay.
which is crucial in such a critical situation.
So the same medication can be given in different ways,
Yeah.
depending on the urgency and
Exactly.
the, its specific medical condition.
Exactly.
What about salbutamol? I know it's typically given through an inhaler, but are there other ways to administer it?
You're right. Inhalers are definitely the most common way to give salbutamol,
Okay.
especially for asthma attacks and COPD exacerbations, because it gets the medicine right to the lungs
Right.
where it's needed most.
Okay.
But we can also administer it through a nebulizer,
Oh,
which basically turns the medication into a fine mist that's inhaled through a mask.
Oh.
This can be really helpful for, say, young children
Yeah.
or older adults who might have trouble using an inhaler properly.
Right. Oh,
So there are options for, different needs.
that's good to know. Now, dexamethasone,
Yeah.
how is that usually given?
So dexamethasone can actually be administered in a few different ways,
Okay.
depending on what we're treating and how severe it is.
Okay.
For like mild to moderate inflammation,
Yeah.
it can be taken orally, like in a tablet form.
Okay.
But for more serious cases,
Yeah.
we might give it intravenously or intramuscularly for a faster, stronger effect,
Okay.
and for certain skin conditions.
Yeah.
We can even apply it topically as a cream or ointment.
So it truly is like a versatile medication.
It is, very much so.
But with all that versatility,
Yeah.
I imagine there must be some challenges, right?
Oh, there definitely are.
In terms of like administration and
Yeah.
making sure people are getting the right dose. And
Absolutely. One of the biggest challenges with, well, any medication,
Yeah.
but especially those given intravenously, is making sure we're getting that dosage right.
Right.
Too little might not work,
Yeah.
but too much can cause those serious side effects that we talked about before.
Exactly. Yeah.
So it's super important to have trained healthcare professionals administering these medications
Right.
and watching the patient's responses really closely.
It sounds like a delicate balancing act.
It can be, for sure.
What about
Yeah.
potential interactions between these medications and other drugs
Right.
that someone might be taking? Is that something to be aware of?
That's a fantastic question.
Yeah.
Drug interactions are always a concern,
Right.
especially for people who are on multiple medications,
Right.
like epinephrine, for example.
Mhm.
It can interact with certain antidepressants and beta blockers,
Yeah. Wow.
which could lead to some pretty dangerous blood pressure changes.
So it's not as simple as just
Right.
taking a medication and assuming it'll just work on its own.
Exactly.
Yeah.
It's crucial for people to tell their doctors and pharmacists
Mhm.
about all the medications they're taking,
Yeah.
including over-the-counter stuff and herbal supplements,
Right.
to avoid any potential interactions.
So open communication
Yes, that's key.
is really important.
It is.
One thing that has really stood out to me during this whole deep dive
Mhm.
is just how much more there is to these medications
Yeah.
than, just what we see on the surface. It's
It's-
not just about knowing their names
Right.
and, what they're for, but really understanding like all their complexities,
Mhm.
their benefits, risks, and really using them responsibly.
I think you've captured it perfectly.
Yeah.
It's about giving people that knowledge
Mm-hmm.
and encouraging them to be active in their own healthcare decisions.
Exactly.
Knowledge is power, especially when it comes to medications.
So well said.
Yeah.
As we wrap up this deep dive into the world of emergency medications,
Mm-hmm.
what is the one key message that you want our listeners to take away from all of this?
I want everyone listening to feel empowered to ask questions,
Yeah.
seek clarification,
Mm-hmm.
and really advocate for themselves when it comes to their health and the meds that they're prescribed.
Yeah.
Remember, your healthcare providers are your partners in this journey,
Mm-hmm.
and talking openly with them is essential for making sure you get safe and effective treatment.
That's such great advice. We've learned so much today.
We have.
From how these medications work, down to the cells, to
Yeah.
their different uses, and the importance of using them carefully.
Absolutely.
I hope everyone listening feels a lot more informed and confident
Yeah.
about navigating this world of emergency medications.
Me too.
And remember, the learning doesn't stop here.
It never does.
There's a whole universe of medical knowledge out there just waiting to be explored.
That's the beauty of it.
A huge thank you to our expert for leading us through this fascinating deep dive.
Oh, it's my pleasure.
And thank you to all of you for joining us.
Yes, thank you.
Remember to stay curious, keep learning,
Mm-hmm.
and don't be afraid to ask questions. We'll see you on our next deep dive.
See you then.
All right, welcome to your personalized deep dive. You sent over this document, pasted text, and wow, it's like packed with info on all sorts of drug classes.
Yeah, it's quite a compilation.
So what we're going to do is break it down, focusing on, how these meds actually work in your body and what's really important for you to know about the effects, like what really matters.
Right, like a cheat sheet to understanding what's happening at like a cellular level,
Yeah,
those complex processes.
exactly. Okay, so let's jump right in. Let's start with immunosuppressants.
Okay.
Now, I know this might sound kind of counterintuitive. Why would we want to suppress our immune system? I mean, it's supposed to protect us, right?
Yeah.
It's almost like intentionally uh, disarming your own security system.
Yeah, that's a good way to put it. And the reason we would do that is sometimes that security system, it can go haywire. And instead of protecting the house, it starts attacking the house itself.
Oh, okay.
So it's like, if you had a friendly dog and all of a sudden it turns on its owner, that's kind of what happens in autoimmune diseases. Or in the case of organ transplants, the immune system sees that new organ as a foreign invader
Right.
and tries to reject it.
So it's about like preventing that attack in those specific situations.
Exactly.
Okay. Now the document lists several types of immunosuppressants: calcineurin inhibitors, MTOR inhibitors, corticosteroids, and biologic agents. Can we break down each of those one by one, starting with calcineurin inhibitors? I mean, those even sound intense.
Yeah, they're powerful drugs for sure.
Yeah.
But I think what's fascinating about calcineurin inhibitors like cyclosporine and tacrolimus is that they actually prevent T cell activation.
Okay.
So think of T cells as, the generals in your immune army, right?
Right.
And these drugs stop those generals from sending out the troops.
Oh, okay. I see. So they prevent that whole cascade.
Exactly.
So then if these drugs are so good at suppressing the immune system, what's the downside? There's got to be a trade-off, right?
Oh, absolutely. You're right. I mean, calcineurin inhibitors, they're essential for preventing organ rejection after a transplant. But one of the major concerns is nephrotoxicity,
Oh,
which basically is they can damage the kidneys.
I see.
It's like, you're using this powerful weapon, but it also has some potential collateral damage.
Right.
So that's why regular monitoring is so important to, catch any problems early on.
So it's really about finding that balance between effectiveness and safety, right?
Exactly.
Okay. So next up, we have MTOR inhibitors. The document specifically mentions sirolimus.
Right. So MTOR inhibitors, they work a bit differently. They block a pathway called MTOR, which is involved in regulating cell growth and proliferation.
Oh, okay.
So it's like putting the brakes on those cells, preventing them from multiplying uncontrollably.
I see. And it's also, I think the document mentioned it's used in cancer therapy too, right?
Yeah, that's right. Sirolimus is actually used to treat renal cell carcinoma, which is a type of kidney cancer. And speaking of kidneys, one of the potential side effects of MTOR inhibitors is they can cause high cholesterol and a low platelet count.
Mm-hmm.
And actually, both of those can be tied back to how they work in the body.
Wow. So we're seeing this theme of really powerful drugs that need to be carefully managed.
Right.
All right, moving on to corticosteroids. I feel like I've heard of prednisone before, at least.
Yeah, prednisone, dexamethasone, those are the big players when it comes to corticosteroids.
Okay.
Um, what's important to know is that they have a really wide range of effects. It's not just immune suppression.
Oh, right.
They also have really powerful anti-inflammatory action.
So they're kind of like a fire extinguisher putting out all that inflammation.
Yeah, exactly. It's a good analogy.
Yeah.
So, think about things like asthma, allergies, autoimmune diseases. They can be really helpful.
That makes sense. That's why they're used for so many things. But I also remember hearing about some pretty serious potential downsides, especially with long-term use, right?
Yeah, you're right. I mean, if you use corticosteroids for a long time, it can lead to a whole host of problems like osteoporosis, high blood sugar, even psychiatric problems.
Really?
Yeah. So it's really a matter of weighing those benefits and those risks carefully. And doctors, they always try to use the lowest effective dose, to minimize those potential problems.
So again, a powerful tool, but one that needs to be used carefully. Okay, the last type of immunosuppressant that's mentioned is biologic agents. Now, these sound almost futuristic.
They're pretty cutting edge. Basically, biologic agents are like the smart bombs of the immune system.
Oh,
They target very specific molecules that are involved in the immune response. It's kind of like a GPS-guided missile. Like they're going right to the target.
so it's not just shutting down the whole thing. It's like disarming a very specific part of the immune system.
Exactly. And that's what makes them so useful in treating autoimmune diseases like rheumatoid arthritis, where, the body's own antibodies are attacking the joints.
Right.
It's like telling those specific antibody factories to, stop production.
That's fascinating. But even with that targeted approach, are there still risks involved?
Oh, of course. I mean,
Oh.
anytime you're weakening a part of the immune system, you're increasing the risk of infections.
Right, of
So
course.
it's always, it's a balancing act when it comes to immunosuppression.
Okay, I'm starting to see like the complexity involved in managing these medications.
Definitely.
All right, let's shift gears a little bit and talk about a category that's always in the news, antivirals. It seems like we're constantly hearing about, new viruses, the struggles to develop effective treatments.
Yeah, it's a constant battle, that's for sure.
And what makes viruses so tricky is, I mean, they're not like bacteria, right?
Right, they're not like bacteria.
They're not these independent organisms floating around.
Right, viruses actually hijack our own cells to replicate.
Oh, wow.
So it's kind of like, imagine a hacker taking control of your computer system. Right. So instead of just trying to kill a free-floating enemy, you're trying to stop something that's happening inside your own cells.
Right, and that's got to be so much harder.
Yeah, it's a much more difficult challenge.
So the document focuses on antivirals for HIV, hepatitis C, and herpes. Can we start with HIV medications? Specifically, it mentions efavirenz and tenofovir.
Okay. So those drugs, efavirenz and tenofovir, they work by inhibiting an enzyme called reverse transcriptase.
Okay.
HIV needs this enzyme to basically insert its genetic material into our DNA.
Right.
So imagine, you've got your cells and HIV is trying to break in, like a burglar, right?
Mhm.
And these drugs are like this high-tech security system keeping the bad guys out,
Oh, okay.
right? Preventing that break-in.
That's a great analogy. And I remember learning about HAART, which is highly active antiretroviral therapy, and how it's been such a game changer in managing HIV.
Oh, absolutely. I mean, that's been a huge breakthrough, basically combining different antivirals that target different stages of that virus's life cycle. It's incredibly effective at suppressing HIV and allowing people to live long and healthy lives. It's like having, multiple layers of security to keep that virus under control.
Right, so it's not just one thing, it's like a multi-pronged attack.
Exactly.
That's incredible. But are there side effects that people need to be aware of?
Yeah, I mean, with any medication, there are potential side effects. With efavirenz, one of the common ones is it can affect the central nervous system, so things like dizziness, vivid dreams.
Yeah.
Some people say it makes their dreams really weird and surreal.
Really?
Yeah. And then with tenofovir, there's the potential for kidney damage and bone density loss. So those are things that need to be monitored carefully.
So again, it's about weighing those benefits and the risks.
Yeah.
Okay. Okay, moving on to anti-HCV medications. The document mentions sofosbuvir and ledipasvir.
All right, so this is where things get really interesting. I mean, these drugs, they're actually capable of eliminating the hepatitis C virus in many patients.
Oh, that's amazing.
Yeah, it's been a huge advancement in the treatment of hepatitis C.
How do they work so effectively?
So basically, they work by targeting different stages of the virus's life cycle.
Okay.
So sofosbuvir goes after the polymerase enzyme, which is responsible for replicating the virus's genetic material. And then ledipasvir blocks a protein that's essential for assembling new virus particles. So it's like disrupting the virus's assembly line,
Oh, okay.
preventing it from making copies of itself.
So it's like a 1-2 punch that knocks out the virus.
Yeah, that's a good way to put it.
And the document mentions something about genotype-specific treatment. What does that mean?
Right, so different HCV genotypes, they respond better to different combinations of drugs. It's like having different keys to unlock different doors.
Oh.
And, for those who like to get into the details, it's also worth noting that these drugs can interact with other medications. So careful management is really key.
So it's a powerful treatment, but one that requires a really personalized approach. Okay, the last type of antiviral mentioned is for herpes simplex and varicella zoster, which I think those are responsible for like cold sores and chickenpox, right?
Yeah, that's right.
And I'm guessing acyclovir and valacyclovir, pretty familiar names to a lot of people.
Yeah, most people have probably heard of those.
Okay.
So they work by inhibiting viral DNA polymerase, which is basically the enzyme that the virus needs to copy its genetic material.
Okay.
So imagine like a copy machine that's essential for producing those viral blueprints, right?
Right.
These drugs, they jam that machine
Okay, I like that.
and they prevent the virus from replicating.
And the document mentioned that valacyclover has better bioavailability.
Right.
What does that mean, like, in practical terms?
It basically means that your body absorbs valacyclover better than a cyclover.
Okay.
So you need fewer doses to achieve the same effect.
Okay. So it's like more bang for your buck, basically.
Yeah, fewer trips to the pharmacy.
That's definitely a plus. Okay, we've covered a lot of ground here, from taming the immune system to battling those tricky viruses.
Yeah. All right. Let's shift gears now and explore the world of hormones.
Yeah.
Those chemical messengers that orchestrate so many processes in our bodies.
Yeah, it's incredible how these tiny molecules can have such a huge impact on, our overall health and well-being. The document highlights thyroid hormones, oral contraceptives, insulin, and estrogens and progestins.
Okay.
Can we start with something I know a lot of people are probably familiar with, like thyroid hormones? Specifically, it mentions levothyroxine.
Right. So levothyroxine is basically synthetic thyroid hormone. It's used to treat hypothyroidism, which is,
Yeah.
a condition where the body just doesn't produce enough of its own thyroid hormone.
Right. And I remember learning that the thyroid gland plays a crucial role in metabolism. It's like the body's internal thermostat, right?
Yeah.
Regulating how fast we burn energy.
Exactly. So when thyroid hormone levels are low, everything just kind of slows down.
Okay.
You might feel tired, gain weight, have trouble concentrating. It's like your whole system is running in slow motion.
Yeah.
And so levothyroxine basically steps in to replace what's missing and get things back up to speed.
That makes a lot of sense. The document mentions that careful dose adjustment is key based on TSH levels.
Right.
Can you explain that connection?
Yeah. So TSH stands for thyroid stimulating hormone. It's basically a messenger that's sent from the pituitary gland in the brain to the thyroid gland. And it's telling the thyroid, how much hormone to produce.
Okay.
So by measuring TSH levels, doctors can fine-tune that dosage of levothyroxine to make sure that the thyroid's getting just the right amount of stimulation. It's like adjusting that thermostat to get the temperature just right.
It's all about that balance, right?
Exactly.
Okay. Let's move on to a topic I'm sure many listeners are curious about. Oral contraceptives, often just referred to as the pill.
Yeah. So the pill has been, it's been revolutionary for women, giving them more control over their reproductive health, family planning.
Right.
But what's interesting is that the uses extend beyond just preventing pregnancy.
Oh, that's right. The document mentioned that they're also used for regulating periods, managing PCOS.
Exactly. So oral contraceptives, they contain synthetic versions of estrogen and progesterone, the hormones that regulate the menstrual cycle. So by adjusting the levels of these hormones, doctors can actually address, a whole range of issues, from heavy or irregular periods to polycystic ovary syndrome, even acne in some cases.
So it's pretty versatile, huh?
Very versatile.
Yeah. But I also know that there are risks associated with oral contraceptives, especially that risk of blood clots. That always seems to be a big concern.
Yeah, that's an important consideration. And, the
Good.
document really emphasizes that, women who smoke and those over 35, they're at increased risk of thrombosis,
Right.
which is the formation of blood clots. So it's really crucial to have, an open and honest conversation with your doctor about your individual risk factors
Right.
and make an informed decision together.
Yeah. It's a good reminder that every medication, has potential benefits and risks.
Definitely.
Okay. So let's switch gears now and talk about insulin, which is literally a lifesaver for people with diabetes.
Right. So insulin is a hormone that acts like a key, unlocking the doors of our cells to allow glucose to enter. And glucose is the body's primary source of energy. But in diabetes, that process is disrupted. So either the pancreas isn't producing enough insulin, that's type 1 diabetes,
Right.
or the body's cells just aren't responding to insulin properly. And that's type 2 diabetes.
Okay. And I remember learning about different types of insulin, like fast-acting and long-acting. Why is that distinction important?
Yeah, good question. So fast-acting insulin is taken around meal times to basically control that immediate spike in blood sugar that happens when you eat. It's like giving the body a quick boost of insulin to handle that influx of glucose.
Okay.
And then long-acting insulin, it provides kind of a steady background level of insulin throughout the day, keeping those blood sugar levels stable even when you're not eating.
So it's like having two different tools to manage blood sugar levels.
Exactly.
And the document emphasized the importance of, blood sugar monitoring and specifically the risk of hypoglycemia.
Right. Hypoglycemia, which is low blood sugar, that's a serious side effect of insulin therapy. It can lead to, shaking, confusion, even seizures if it's left untreated.
Right.
So careful monitoring and dose adjustment are really crucial to prevent those dangerous dips in blood sugar. It's kind of like walking a tightrope.
Right.
You got to find that sweet spot where blood sugar is controlled, not too low.
It sounds like managing diabetes requires like a lot of vigilance, a lot of attention to detail. Okay. The last hormonal medications that are mentioned are estrogens and progestins.
Right.
And it seems like we've kind of come full circle back to the hormones we discussed with oral contraceptives.
In a way, yeah. But estrogens and progestins, they have a much wider range of uses beyond just contraception. The document mentions hormone replacement therapy for managing, menopausal symptoms, as well as treatments for endometriosis, certain types of cancer, and other conditions.
Right. But I also recall like some controversy surrounding the long-term use of HRT.
Yeah, I mean, there are definitely risks to consider, and the document highlights the potential increased risk of thromboembolic events, which are blood clots with long-term HRT use, particularly in, menopausal women.
Mm.
So again, it's all about those conversations with your doctor, weighing those potential benefits against the risks
Right.
and
Right.
making, personalized decisions based on your individual health history.
It's so important to remember, like, there's no one-size-fits-all approach to medicine. Okay. So we've explored the complex world of hormones and all their many roles in the body. Let's move on now to a category that's closely tied to heart health. Statins and lipid-lowering drugs. And I think everyone's probably heard of cholesterol, but maybe not the whole story.
Yeah. Cholesterol often gets kind of a bad rap, but it's not all bad. There's good cholesterol, HDL, and bad cholesterol, LDL. And it's those high levels of LDL that really contribute to cardiovascular disease. Think of it like this. HDL is like a garbage truck, picking up the excess cholesterol, taking it away, and LDL is like, that sticky substance that clogs up your pipes.
Okay, that's a great way to visualize it.
Yeah.
So the document mentions three main categories of lipid-lowering drugs: statins, fibrates, and PCSK9 inhibitors. Can we start with statins, which I think are probably the most well-known? Atorvastatin and simvastatin were the examples given.
Right, statins are definitely the most commonly prescribed cholesterol-lowering drugs, and they work by inhibiting an enzyme called HMG-CoA reductase, which is involved in the production of cholesterol in the liver. So it's like turning down the faucet on cholesterol production.
So they're basically reducing the amount of cholesterol that's being made in the body.
Exactly. And that leads to a decrease in those harmful LDL levels, an increase in those beneficial HDL levels, and ultimately, lower risk of heart attacks, strokes, and other cardiovascular events.
Okay, that sounds pretty impressive. But are there any downsides to taking statins? I've heard some people, complain about side effects.
Yeah. Like any medication, statins can have potential side effects. The document mentions muscle aches, a possible elevation in liver enzymes, and surprisingly, an increased risk of developing diabetes in some individuals.
Oh, really?
Yeah. It's not fully understood why this happens, but it's something to be aware of.
Wow, that last one's a bit unexpected. It really highlights the importance of discussing, those potential risks and benefits with your doctor.
Absolutely.
Okay. So what about fibrates? The document mentions gemfibrozil and fenofibrate.
Okay, so fibrates, they're particularly good at lowering triglycerides, another type of fat found in the blood that can contribute to heart disease. And they're often combined with statins for a more comprehensive approach to managing lipid levels, like a two-pronged attack on those unhealthy fats.
Right. But the document did mention that combining statins and fibrates can increase the risk of muscle problems.
Yeah, you're right. That's an important consideration. When those two drug classes are combined, the risk of muscle damage, which is called rhabdomyolysis, goes up. So careful monitoring and dose adjustments are really essential.
So it's like a team effort, but it requires careful coordination,
Definitely.
Okay. Finally, in this category, we have PCSK9 inhibitors. The document mentions evolocumab and alirocumab. These sound pretty high-tech.
They are. PCSK9 inhibitors are a newer class of drugs. They offer a more potent option for people who don't respond well to statins or can't tolerate them, and they work in a really unique way by blocking a protein called PCSK9, which is responsible for breaking down LDL receptors.
Wait, so these drugs actually help the body clear out more of that bad cholesterol?
Exactly. PCSK9 inhibitors, they increase the number of LDL receptors, which are like little scavengers. They grab onto that LDL cholesterol and remove it from the bloodstream. It's like giving those garbage trucks a bigger fleet.
Right, right.
to clean up those cholesterol-clogged arteries.
I like that. That's a great analogy.
Yeah.
And what's interesting is that these drugs are given as injections, typically every few weeks.
Right. That's a key difference from statins and fibrates, which are taken as pills. So PCSK9 inhibitors really offer a new approach to managing cholesterol, especially for those who haven't found success with other medications.
It's amazing how many options there are now for, managing heart health. It seems like the field of medicine is constantly evolving with new discoveries and treatments emerging all the time.
Absolutely. It's an exciting time to be involved in healthcare, that's for sure, with so many advancements happening, changing the way we approach prevention and treatment.
Okay. Let's take a pause here to kind of absorb all this incredible information about cholesterol and heart health. And when we come back, we'll delve into the complex world of anti-cancer drugs.
Okay. So let's dive into this category that often feels kind of shrouded in mystery, anti-cancer drugs.
Yeah, it's a really complex field and one that's constantly evolving. I know the goal is to target those, rapidly dividing cancer cells while sparing the healthy ones.
Right.
But I mean, that just seems like such a difficult balancing act.
It is. The challenge is to develop drugs that can really precisely target those mechanisms that drive cancer growth
Right.
without causing too much collateral damage, to the rest of the body.
Right, of course. So the document focuses on 4 key classes of anti-cancer drugs: alkylating agents, antimetabolites, monoclonal antibodies, and tyrosine kinase inhibitors. Let's start with alkylating agents.
Yeah.
Specifically, it mentions cyclophosphamide and cisplatin.
All right. So alkylating agents, they're kind of like cellular saboteurs. They work by damaging DNA, which prevents those cancer cells from replicating and spreading. Imagine them as like tiny wrenches being thrown into the machinery of cell division,
Cool.
disrupting the process and halting the growth of those rogue cells.
That makes sense. But I'm guessing that, damaging DNA can't be good for healthy cells either, right?
You're right. Alkylating agents, they can affect healthy cells too, and that's why they come with a range of potential side effects. The document mentions myelosuppression, which is basically a decrease in the production of blood cells.
Yeah.
So this can lead to anemia, a weakened immune system, an increased risk of bleeding, hair loss, potential damage to organs like the kidneys and bladder. Those are all concerns.
So really powerful drugs, but not without risks. What about antimetabolites?
Okay.
The document mentions methotrexate and fluorosil, or 5-FU.
Right. So antimetabolites work a little differently. Instead of directly damaging DNA, they interfere with the building blocks that cancer cells need to create new DNA and RNA. It's like disrupting the supply chain,
Right.
cutting off those essential materials that those cells need to grow and multiply.
So it's a more targeted approach. It's like disrupting a specific factory instead of bombing the whole city.
Exactly. And antimetabolites, they're used to treat a wide range of cancers, from leukemia and lymphoma to breast and colon cancer. But again, they also come with potential downsides, things like myelosuppression and gastrointestinal toxicity, which can cause nausea, vomiting, diarrhea.
Yeah, it seems like there's always this trade-off between, effectiveness and the potential for side effects.
Definitely.
Okay. Next up, we have monoclonal antibodies. I feel like I've heard a lot about these in recent years. The document mentions trastuzumab and rituximab as examples.
Right. So monoclonal antibodies, they're really fascinating. They're like, guided missiles designed to seek out and destroy specific targets on those cancer cells. Imagine them as like tiny assassins with a very specific mission.
Oh, wow. That's incredible. And I remember reading about trastuzumab being used to treat HER2 positive breast cancer.
Right.
Can you explain what that means?
Yeah. So HER2 is a receptor, kind of a docking station on the surface of some breast cancer cells.
Yeah.
And in HER2 positive breast cancer, these receptors are overexpressed, meaning there's like way too many of them. And that actually fuels the growth of the cancer.
Oh, okay.
So trastuzumab is specifically designed to bind to those HER2 receptors, and it blocks their signals, essentially putting the brakes on that cancer growth.
So it's like shutting down the control center of those rogue cells.
Exactly.
That's incredible. But even with that targeted approach, are there still potential downsides?
Yeah. I mean, while monoclonal antibodies are generally well tolerated, they can cause what are called infusion reactions, which are basically like allergic-like responses that can happen, during the intravenous administration of the drug. Rituximab in particular is known for this. And then trastuzumab carries a risk of cardiac toxicity, meaning it can potentially damage the heart.
I see.
So heart function needs to be, monitor very closely during treatment.
So even the most sophisticated weapons can have, unintended consequences.
Right.
Okay. The last category of anti-cancer drugs that's mentioned is tyrosine kinase inhibitors, or TKIs, with imatinib as the example. Can you unpack that for us?
All right, so tyrosine kinases, these are enzymes that play a crucial role in cell signaling pathways, the communication networks that control cell growth and division. And in some cancers, these tyrosine kinases, they become overactive,
Yeah.
sending out those constant signals that just drive uncontrolled growth.
Right.
So TKIs, they work by blocking those overactive enzymes, effectively cutting off the communication lines that are, fueling that cancer growth.
So it's like disrupting the chain of command that's driving those rogue cells to multiply.
Exactly.
And the document mentioned that imatinib was a game changer for treating chronic myelogenous leukemia, or CML.
Oh, absolutely. Imatinib revolutionized CML treatment. I mean, before imatinib, CML was often a fatal disease. But now, thanks to this targeted therapy, many people with CML can live, long and healthy lives.
That's a really incredible testament to, the power of medical research and innovation.
Yeah.
But of course, there are potential side effects with imatinib too, right?
Right. Like all medications, imatinib comes with potential side effects. The document mentions fluid retention, which can cause swelling in the legs and ankles, the potential for myelosuppression, which we discussed earlier, and importantly, significant drug interactions. Imatinib can interact with a wide range of other medications, so careful monitoring and management are really essential.
Okay, another reminder that medications can be powerful tools, but require, careful consideration and management. All right, we've covered a lot of ground here.
Yeah.
From powerful immunosuppressants to targeted cancer therapies. Let's shift gears now to something a little less intense, vitamins and supplements. I think, everyone probably has a bottle of something in their medicine cabinet,
Right.
but maybe not, a full understanding of what they're taking.
Yeah. So vitamins and supplements, they're often seen as kind of extras.
Yeah.
But the truth is they play really essential roles in our health.
Right.
They can help fill those nutritional gaps,
Mhm.
support various bodily functions, and even protect against certain diseases.
Okay.
But it's important to remember that they're not a replacement for, a healthy diet and lifestyle.
Right. It's like they're the supporting actors, they're not the lead role.
Exactly.
So the document focuses on vitamin D, folic acid, iron, and calcium. Starting with vitamin D, it seems like everyone's talking about vitamin D these days.
Right.
What's all the hype about?
Well, vitamin D is definitely having its moment in the spotlight, and for good reason. I mean, it's essential for calcium absorption and bone health, which is why it's so important for preventing osteoporosis.
Right.
But its roles go far beyond just bones. Vitamin D also plays a role in immune function, cell growth, reducing inflammation. Some studies have even suggested that, adequate vitamin D levels might be linked to a lower risk of certain chronic diseases, like heart disease and some types of cancer.
So it's like a multi-talented performer with a wide range of skills. But I remember hearing that you can actually have too much vitamin D.
Yeah, that's true. Excessive intake of vitamin D can lead to what's called hypercalcemia, which
Yeah.
is a condition where there's just too much calcium in the blood.
Okay.
And that can cause a range of symptoms, from nausea and vomiting to kidney stones and even heart problems. So while vitamin D is essential, it's important to get your levels checked,
Yeah. Right.
and not overdo it.
Got it. Everything in moderation.
Exactly.
Okay. What about folic acid? I know that's, crucial during pregnancy.
Right. So folic acid, also known as vitamin B9, it's essential for cell division and DNA synthesis, which is why it's so critical during pregnancy for the development of the baby's neural tube, which forms the brain and spinal cord. But, folic acid is important for everyone, not just pregnant women. It plays a role in red blood cell formation, helps maintain healthy homocysteine levels, which is an amino acid that's been linked to heart disease, and it supports cognitive function.
And the document mentioned an interesting fact that high doses of folic acid can mask vitamin B12 deficiency.
Right, and that's a really important point. Vitamin B12 is crucial for nerve function and red blood cell production. And a deficiency can lead to some serious neurological problems, things like fatigue, weakness, and even dementia. Unfortunately, high doses of folic acid can actually hide those symptoms of a B12 deficiency, delaying diagnosis and treatment.
Oh, wow.
So if you're taking high doses of folic acid, it's essential to make sure you're not masking a B12 deficiency. Talk to your doctor, about getting your B12 levels checked.
Okay, so something to be aware of. All right. Next up, we have iron supplements. I think everyone knows they're for anemia, but maybe not the why behind it.
Right. So iron is a crucial component of hemoglobin. That's the protein in red blood cells that carries oxygen throughout the body. When iron levels are low, you can develop iron deficiency anemia, which means your body's just not getting enough oxygen.
Okay.
This can lead to fatigue, weakness, shortness of breath, pale skin, and other symptoms. So iron supplements help replenish those iron stores, allowing the body to produce more red blood cells and get that oxygen flowing again.
And the document mentioned that iron is best absorbed on an empty stomach, but that it can cause, GI upset. What's the best way to kind of navigate that?
Yeah, it's a little bit of a balancing act. Taking iron with food can reduce absorption, but taking it on an empty stomach can be really tough on the digestive system, causing nausea, constipation, diarrhea. So it often comes down to just finding what works best for you. Some people find that taking iron with a small amount of food helps to minimize those side effects without significantly impacting the absorption.
Okay. And I remember reading that vitamin C can actually help with iron absorption.
Yeah, that's a great tip. Vitamin C enhances iron absorption. So taking your iron supplement with, a glass of orange juice or some other source of vitamin C-rich food can boost its effectiveness.
Good to know. Okay. Finally, in this category, we have calcium,
Right.
which is, essential for strong bones and so much more.
Yeah. Calcium is the most abundant mineral in the body. And it's not just about bones. I mean, calcium is involved in a wide range of bodily functions, including muscle contraction, nerve transmission, blood clotting, regulating blood pressure.
Wow. It's like a multitasking superhero.
It is.
But the document also mentioned that excessive calcium intake can lead to kidney stones.
Yeah, that's true. While calcium is essential, too much of it combined with other substances in the urine, and that forms those painful kidney stones. And the document also highlighted the importance of vitamin D for calcium absorption. Vitamin D acts like a chaperone, helping that calcium get absorbed from the gut into the bloodstream.
Okay.
So if you're taking calcium supplements, make sure you're also getting enough vitamin D.
It's fascinating how all these nutrients work together to keep our bodies functioning properly. Okay. We've covered a lot of ground here from essential nutrients to the potential risks of overdoing it. Let's move on to our final category for today. Anxiolytics or anti-anxiety drugs.
Okay. So anxiety is incredibly common, and it's important to distinguish between that normal worry, which is a natural part of life, and anxiety disorders,
Yeah.
which can really significantly impact daily life and well-being.
Right. And the document focuses on three main types of anxiolytics: benzodiazepines, buspirone, and beta blockers. Let's start with benzodiazepines. I know these are often prescribed for anxiety, but I'm not exactly sure how they work. The document mentions diazepam, lorazepam, alprazolam, and clonazepam as examples.
Right. So benzodiazepines, they're fast-acting medications that provide really quick relief from anxiety symptoms. They work by enhancing the effects of GABA, which is a neurotransmitter that has a calming effect on the brain. Think of GABA as like the brain's natural braking system, slowing down those racing thoughts, those feelings of anxiety. And benzodiazepines boost the effectiveness of that braking system, helping to, quiet the storm of anxiety.
So they're like a quick-acting tranquilizer for the brain.
Yeah, that's a good way to put it. Yeah.
But I've also heard concerns about benzodiazepines, especially that risk of dependence.
Yeah, you're right. Benzodiazepines are generally not recommended for long-term use because they can lead to tolerance and dependence. And the document really emphasizes the importance of, short-term use and careful tapering when discontinuing these medications. Withdrawal from benzodiazepines can be uncomfortable, even dangerous in some cases.
Yeah, it's definitely a medication that requires careful consideration and, close monitoring by a healthcare professional. What about buspirone? I'm not as familiar with that one.
Okay, so buspirone is an interesting alternative to benzodiazepines. It works differently, targeting serotonin and dopamine receptors in the brain, and it doesn't have those same sedative effects or risk of dependence.
Oh, okay. So it's a potential option for, longer-term anxiety management without those worrisome side effects.
Exactly. But it's important to note that buspirone, it takes a few weeks to become fully effective, so it's not ideal for, acute anxiety or panic attacks.
Got it. Different tools for different situations.
Right.
Okay, finally, we have beta blockers. And I know those are typically used for heart conditions, but how do they help with anxiety?
Right. So beta blockers are primarily used to treat high blood pressure and heart rhythm disorders. but they can also be helpful for managing the physical symptoms of anxiety. Things like a racing heart, trembling, sweating. They work by blocking the effects of adrenaline, which is that hormone that triggers that fight or flight response.
Okay.
So think of them as kind of a shield,
Okay.
protecting you from those physical manifestations of anxiety.
So they don't necessarily stop those anxious thoughts, but they can like help control those physical symptoms that can make anxiety so overwhelming.
Exactly. And they're often used for, performance anxiety,
Yeah.
like stage fright or public speaking,
Yeah.
where those physical symptoms can be really distracting and debilitating.
Right. Right. Wow, we've covered so much ground today. It's been an incredible deep dive into this world of medications, from those powerful immunosuppressants to essential vitamins to anxiety-taming drugs. I mean, it's just amazing.
It is. It's amazing how much we've learned about these intricate workings of these medications, how they interact with our bodies. But, what's even more fascinating is that this is just a glimpse into this vast and ever-evolving world of pharmacology. New discoveries are being made all the time. Our understanding of these drugs is constantly expanding.
It really highlights the importance of, staying informed, asking questions, and having those open conversations with our healthcare providers to make the most informed decisions about our health.
Absolutely. Knowledge is power when it comes to, managing our health and well-being.
Well, thank you so much for joining us on this deep dive into the world of medications. We hope you've gained, a new appreciation for the complexity and wonder of these powerful tools that can both heal and harm. And remember, this is just the beginning of your journey. Keep exploring, keep asking questions, and keep taking an active role in your own health. Welcome back, everyone. We're diving into a topic today that I think a lot of you might be familiar with, at least on the surface. You sent in information on oral glucose, dextrose, and glucagon, all kind of related, right? Especially if you've ever, dealt with low blood sugar. But having sources on all three of them, that's what makes me think there's more to this story than meets the eye.
You're definitely onto something there. It's not just about knowing they exist. It's about understanding how they all fit into the bigger picture, how they work within, blood sugar management overall.
Okay, so let's start with something I think a lot of people have actually seen in their lives. Those little tubes of oral glucose gel or the chewable tablets. What exactly is oral glucose, and why is it like the go-to for so many people when their blood sugar dips?
Oral glucose. Well, at its simplest, it's basically pure glucose, the most basic form of sugar, you could say. And when we talk about blood sugar, we're really talking about the level of glucose that's, circulating in your bloodstream. It's your body's main energy source, and that's especially true for the brain.
So, okay, oral glucose, it's like this direct hit of energy for your system. But why is that so crucial when your blood sugar drops too low?
Well, when your blood sugar dips, and we call that hypoglycemia, your body and brain, they just don't have the fuel they need.
Right.
They can't function the way they should. And you might start to feel, weak, shaky, even confused. Some people have trouble speaking even. And in really severe cases, it can even lead to seizures or even losing consciousness.
Wow. Okay, so that sounds pretty serious. I can definitely see why getting that glucose level back up is so important and fast.
Exactly. And that's where the simplicity of oral glucose really shines, because it's absorbed so quickly from, your digestive tract. It bypasses a lot of those complex processes that other carbs have to go through.
So it's like taking the express lane straight to your bloodstream.
Yeah.
This might sound kind of silly, but I've always wondered, is it really that different from just eating like a piece of candy?
That's a good question, actually. And while sugary foods can raise blood sugar, they also contain fats and proteins and things that slow down how quickly that sugar gets absorbed. Oral glucose it's pure glucose, essentially, designed to be taken up rapidly.
Okay, so it's formulated for speed, basically. But this brings me to something that's been bugging me a little as I've been looking through these sources. We've got oral glucose, we've got dextrose, and then there's glucagon. And glucagon, that just sounds so much more mysterious somehow.
Glucagon is definitely the wild card in this group, because it's not actually a sugar like the others. Glucagon is a hormone, something our bodies naturally produce. And when it comes to blood sugar, glucagon is like, almost like having a backup generator.
A backup generator. Okay, I like that.
Think of it this way. If your blood sugar drops and say oral glucose isn't enough, or maybe you can't even swallow, your body needs a way to access its own stored energy, right? That's when glucagon kicks in.
So it's like sending out an SOS to your body's reserves. Where are those reserves?
Primarily in your liver. stored as glycogen. And what glucagon does is it signals to the liver to break down that glycogen and release glucose into the bloodstream.
That's pretty amazing. So it's not giving you sugar directly like glucose does. It's telling your body, hey, release your own stash.
Mm.
I gotta admit, I always pictured our bodies running just on, whatever we ate at that moment.
A lot of people think that. But
Yeah.
we've got these incredible regulatory systems to keep our blood sugar stable, even if we haven't eaten in a while.
So speaking of stable blood sugar, the listener also sent in some info on dextrose. Isn't that basically just another name for glucose? Why do we need both terms?
You're right. They're very similar, and dextrose, IS-glucose, but there's a subtle difference. When we're talking about dextrose, medically speaking, we're usually referring to its use in, IV solutions.
Okay. So this is for when someone can't swallow those glucose tablets or if they need a super fast boost.
Exactly. 4V dextrose, it completely bypasses the digestive system. It goes straight into the bloodstream for near instant action.
Okay, this is starting to make a lot more sense. So we've got oral glucose for everyday dips, IV dextrose for emergencies, and then glucagon as the backup. Yeah, tapping into those internal reserves.
You got it. And that's why understanding all three is so important. It's not just about treating low blood sugar. It's about using the right tool for the right job at the right time.
This raises a really interesting question then. How do medical professionals decide which one to use? I mean, there are clearly a lot of factors to consider.
There are, absolutely. And that's where the details get really fascinating. But before we jump into all that, let's take a closer look at how each of these blood sugar heroes works. On a physiological level, what's actually going on in the body.
Well,
Welcome back. Before we get into like the when and how of each of these blood sugar interventions, we were talking about how they actually work, on a physiological level. Let's start with oral glucose. That seems like the easiest one to grasp.
Yeah, I mean, on the surface, it seems simple enough, right? You eat it, your body absorbs it, blood sugar goes up. But I'm kind of curious about the finer points, what's actually happening at like the cellular level when you take oral glucose.
Well, you got to remember that glucose it's the primary fuel source for all our cells. When you take oral glucose, it's absorbed really quickly through the lining of your small intestine. It goes into the bloodstream. And from there, it's distributed throughout your body. And that's where the cells can take it up and use it for energy.
Okay, that makes sense. But I'm guessing it's not quite as simple as just like, dropping glucose into the cells. There's going to be some kind of mechanism there, right?
You're absolutely right. Cells can't just absorb glucose all willy-nilly. They need help from a hormone. It's called insulin. You can think of insulin as the key that unlocks the door for glucose to get into the cells.
So insulin is like the gatekeeper.
Exactly. And when your blood sugar rises, like after you take oral glucose, your pancreas, it senses that increase and it releases insulin into the bloodstream. And then that insulin binds to receptors on the cell surfaces, and that binding, that's the signal for the cells to open up those glucose doors, so to speak, and start taking in the sugar.
Okay, so it's like this chain reaction, oral glucose boosts blood sugar, the pancreas pumps out insulin, and insulin tells the cells to grab the glucose.
Yeah.
Pretty neat. But the sources you sent, they also mention some potential downsides to using oral glucose. It seems like even simple sugar can be a little tricky sometimes.
Oh yeah, for sure. Even though oral glucose is generally safe and effective, there are definitely some risks to keep in mind. The most common one is probably hyperglycemia, which is basically high blood sugar.
So it's accidentally possible to overcorrect, like accidentally give your body too much fuel.
Exactly. It can happen if you take too much oral glucose or if your body isn't producing enough insulin to handle that sudden rush of sugar. And this is especially a concern for people with diabetes, whose insulin production or response is already impaired.
Yeah, that makes sense. It's a good reminder that even things that seem, harmless, like sugar, they can have some unintended consequences if they're not used carefully. Are there other things to watch out for with oral glucose?
Yeah, some people experience gastrointestinal upset after taking it,
Yeah.
especially if they take a large amount, things like nausea, bloating, maybe even diarrhea.
Okay, that doesn't sound fun. It seems like finding the right dosage is really important.
Oh, absolutely. And that's why it's so important to follow, your doctor's advice and read those instructions carefully on any oral glucose product that you might use.
Here.
Now, moving on to dextrose, which is, administered intravenously, that brings up a whole different set of considerations.
Yeah, that makes sense. I mean, injecting something directly into the bloodstream seems a lot more intense. How does that impact its effects?
Well, the main advantage of high-V dextrose is speed, because it bypasses the digestive system entirely. It gets into the bloodstream almost immediately, starts raising those blood sugar levels within minutes, really.
So that's what makes it ideal for emergencies then, right? When time is of the essence.
Exactly.
But I imagine bypassing the digestive system could also have some potential downsides.
You're right, yeah. One potential risk is phlebitis, which
Okay.
is basically inflammation of the vein. Where the IV is inserted, it can cause pain, redness, and swelling at the injection site.
Oh, that doesn't sound pleasant at all. What causes that?
It's often related to the concentration of the dextrose solution, or how quickly it's infused. If
Yeah.
the solution is too concentrated, or if it's given too fast, it can irritate the vein. And proper technique when inserting the IV is really crucial as well.
So it's really important to have, trained medical professionals handling this kind of intervention. I'm guessing there are other potential risks to consider as well.
There are. Another one is fluid overload. If someone receives too much fluid through the IV, it can put a strain on their heart and kidneys, especially if they have some underlying health conditions.
So it's all about careful monitoring and dosage control, right? When
Right.
using IV dextrose, it's clearly a very powerful tool, one that requires expertise to use it safely and effectively.
Absolutely, it
Yeah.
is. It's like a high-performance race car. Incredibly powerful, but you really need a skilled driver behind the wheel.
Okay, I love that analogy. Now let's switch gears a little and talk about glucagon. That backup generator for blood sugar that we talked about earlier. We mentioned that it signals the liver to release stored glucose, but I'm curious about how that signaling process actually works.
Well, it involves a pretty fascinating cascade of events, actually. So when your blood sugar drops too low, the pancreas releases glucagon into the bloodstream. The glucagon travels to the liver and binds to specific receptors on the liver cells. And this binding, it triggers a process called glycogenolysis, which is the breakdown of glycogen into glucose.
Glycogenolysis. Okay, that's a mouthful.
It's a big word for a big job. Glycogen is like, you can think of it as your body's energy savings account.
Yeah.
It's how we store excess glucose for later use.
Okay, so glucagon is the key that unlocks that savings account, right? When our energy is running low, it's incredible how our bodies have these backup systems in place, but I'm guessing that even with such a well-designed system, there are still potential downsides to using glucagon, right?
There are, yeah. Even though glucagon is generally safe, especially in emergency situations, there are a few things to keep in mind. One common side effect is nausea and vomiting, which can be, pretty unpleasant, especially if you're already feeling unwell because of low blood sugar.
Yeah, I can imagine that wouldn't help the situation.
Not at all. Another side effect, though less common, is an allergic reaction. Some people they're sensitive to glucagon, and they can develop things like, rash, itching, or swelling after an injection.
Okay, so important to watch out for those potential side effects and seek medical attention if anything unusual happens after giving glucagon. But overall, it sounds like an incredibly valuable tool, for managing those really severe hypoglycemic episodes.
It is, absolutely. It's really a testament to the body's, remarkable ability to regulate itself and tap into its own resources when it really needs to. Now that we've looked closer at how each of these interventions actually works, let's move on to the practical side of things. How do we decide which one is the right one to use, in different situations?
Okay, so we've covered a lot of ground here, from the cellular level all the way up to the different ways we can actually intervene when blood sugar goes out of whack. I think it's time to put all this knowledge into practice. Let's say someone's at home and they're feeling those classic signs of hypoglycemia, shaky, sweaty, maybe a little lightheaded. What's the first thing they should do?
Well, if they're conscious and they can swallow okay, reaching for those oral glucose tablets or gels is definitely the best first step. They're designed for quick absorption,
Right.
and they can usually bring blood sugar levels back up within 10 to 15 minutes, something like that.
Okay, so oral glucose is the go-to for, those mild or moderate hypoglycemia episodes. But what if those symptoms don't improve? Or what if, they actually start feeling worse?
That's a red flag,
Mhm.
That's when you really need to seek medical attention right away. It could be that the hypoglycemia is more severe than you initially thought,
Yep.
or there could be some underlying medical condition that needs to be addressed.
Right. So don't hesitate to call for help if things aren't getting better on their own. Okay, now let's imagine a more critical situation. Someone collapses unconscious and you suspect it's because of really low blood sugar. What do you do in that situation?
In that case, time is absolutely of the essence. Calling 911 or your local emergency services, that's the top priority. And then while you're waiting for help to arrive, if you have access to a glucagon kit and you've been trained to administer it, that could be a life-saving intervention, truly.
Wow, okay. That really underscores the importance of being prepared, and knowing how to use glucagon in an emergency. But I imagine administering an injection, I mean, that can be pretty intimidating, especially under pressure.
It definitely takes training and practice, but thankfully the glucagon kits come with clear instructions. They often have like practice devices so people can get comfortable with the process before they ever have to use it for real.
That's good to know. It really does highlight how important it is to be prepared, to know what to do in those critical moments. Okay, let's talk about a hospital setting for a moment. We mentioned earlier that IV dextrose is a real game changer in emergency situations. Can you elaborate a little on how it's used in that context?
Well, in a hospital, the healthcare professionals, they have the tools and the expertise to closely monitor blood sugar levels
Yeah.
and adjust treatment accordingly. 4-V's dextrose is often the preferred method for raising blood sugar quickly. In severe cases, because it provides such a precise dose, and it acts almost instantaneously.
So it's like having a direct line to fine tune those blood sugar levels. It's pretty powerful. One thing that's been on my mind throughout this whole deep dive is the question of prevention. Is
Yeah.
is there anything people can do to, reduce their risk of experiencing hypoglycemia in the first place?
That's a great question and a really important one for people with diabetes, carefully managing their condition. Through medication, diet, and exercise is absolutely crucial. And regular blood sugar monitoring, that can really help them identify patterns, and make adjustments to avoid those dangerous drops in blood sugar.
Right. So it's all about being proactive and staying on top of those levels. But what about for people who don't have diabetes? Are there any general lifestyle tips that can help maintain healthy blood sugar?
Oh, definitely. Eating a balanced diet, one that's rich in fiber and low in processed sugars, that's a great place to start.
Hmm.
Regular physical activity also plays a key role in improving insulin sensitivity,
Hmm.
which helps your body regulate blood sugar more effectively.
So the classic advice still holds true, huh? Eat well, move your body.
Pretty much.
But sometimes even with the best intentions, life throws us curveballs, right?
Yeah.
Stress, illness, unexpected changes in routine, all those things can impact blood sugar.
They really can, yeah.
Yeah.
It's so important to listen to your body and be aware of any changes in how you're feeling. If you start experiencing those symptoms of hypoglycemia, don't ignore them. Take action, whether it's, grabbing those glucose tablets or calling your doctor.
Good advice. And speaking of seeking knowledge, I have to bring up something that we haven't really touched on yet. We've been so focused on low blood sugar, but what about the opposite? What about when blood sugar goes too high?
Excellent point. High blood sugar or hyperglycemia, as it's called. That's a
Mhm.
whole other topic, often associated with diabetes, and we don't really have time to get into all the details today. But it is worth mentioning that the key player in managing high blood sugar is insulin.
Oh, right, the gatekeeper we were talking about earlier. So instead of giving the body more glucose, the focus
Yeah.
shifts to making sure insulin is working the way it should.
Exactly, and that can involve all sorts of approaches, from lifestyle changes to different types of medications, even. But as you said, that's a deep dive for another day.
Well, folks, we've reached the end of our exploration into the world of blood sugar. And I don't know about you, but I'm feeling a lot more empowered now knowing all this, knowing the roles of oral glucose, IV dextrose, and that fascinating hormone glucagon.
It really is
Yeah.
amazing how our bodies have these intricate systems in place, you know, and knowing how they work, it allows us to make informed decisions about our health.
Couldn't agree more. And remember, this is just the beginning of your deep dive, everyone. Keep exploring, keep asking questions, keep learning. Until next time, stay curious.
And stay well.
Welcome back, everyone. We're diving deep today into three pretty interesting medications.
Oh yeah, definitely interesting. Naloxone, hydrocortisone, and then there's oxytocin.
You know, They might sound kind of familiar, but stick with us. I bet you'll learn something new, even if you think you know these meds inside and out.
Definitely.
First up, we've got naloxone. The one that's a total lifesaver for opioid overdoses.
It really is incredible how effective it can be.
Then there's hydrocortisone. I feel like everyone's used that at some point for, like, inflammation.
Right. Super common.
And oxytocin. Well, let's just say it's got that whole love hormone thing going on.
Yeah, it's earned that nickname for sure.
But trust me, there's so much more to these medications than meets the eye.
Absolutely.
And the way they work in the body tells a pretty amazing story about how all our systems are, like, totally connected.
It's funny. They might seem like they come from totally different worlds, these medications.
Yeah.
But at the molecular level, they all work by interacting with these very specific receptors in the body.
Oh, interesting.
Yeah, it's like a lock and key mechanism.
Okay, makes sense. So let's start with naloxone then. The miracle drug for opioid overdoses.
Right.
I've always wondered how it can work so fast. Like, what's actually happening at the molecular level when it reverses an overdose?
Okay, so picture this. You've got these opioid receptors in the brain, right? Think of them as like little docking stations.
Okay, I'm picturing.
Opioids come in, like heroin or fentanyl.
Right.
They bind to these receptors,
Uh-huh.
and that triggers all these effects,
Yeah.
which, ultimately can lead to respiratory depression, which is what makes an overdose so dangerous.
Right, because that's when breathing slows down or stops altogether,
Oh, I
right?
see.
And that can be fatal also.
Exactly. Now, naloxone comes in, and it's like a molecular bodyguard, basically,
Oh, okay.
competing with the opioids for those receptor sites.
I see, it's like a competition.
It is, but here's the thing.
Yeah.
Naloxone has this higher binding affinity for those new opioid receptors
Higher than the opioids.
than most opioids, yeah.
Yeah. Oh, wow.
So it's like naloxone is the VIP guest who can, like, bump those opioids right out of their seats.
Oh, I like that analogy.
Uh-huh. Right. And because it binds so tightly to the receptors, it stops the opioids from attaching and doing their thing.
So they can't cause those dangerous effects anymore.
Exactly. And this all happens super quickly, especially when naloxone is given intravenously.
Intravenously. So there are different ways to give naloxone. I always thought it was just those nasal sprays, the ones you see on the news.
Oh, yeah, those nasal sprays are getting more and more common, and they're great, especially for bystanders to use in an emergency situation. But naloxone can also be given intramuscularly, or, like I said, intravenously, which is the fastest way to get it into the system.
So how quickly are we talking here? Like, depending on how it's given, naloxone can work within minutes.
Yeah, so intravenously, you'll usually see effects within about 2 minutes. Intramuscularly, it might take a little bit longer, maybe 5 to 10 minutes. And with the nasal spray, it could be a few minutes longer than that.
Okay, but still pretty fast.
Yeah, very fast. But there's something really important to remember about naloxone.
What's that?
Even though it works super quickly, its effects often wear off before the opioid is completely gone from the body.
Oh, so you might need multiple doses of naloxone to keep someone safe.
Absolutely. That's one of the most important things to remember when you're giving naloxone.
Good point.
The thing is, naloxone is very specific to opioid overdoses. It's not going to work if someone overdoses on something else, like benzodiazepines or alcohol.
Yeah, that makes sense given how specific its mechanism of action is.
Right.
It's like having a key that only fits one specific lock.
Exactly.
But for opioid overdoses, it's a pretty amazing medication, It can literally reverse respiratory depression and give someone another chance.
Couldn't agree more.
Speaking of remarkable medications, let's move on to hydrocortisone.
All right, hydrocortisone.
This one plays a big role in regulating inflammation and the immune response.
Right, and what's really cool about hydrocortisone is that it basically mimics this natural hormone, cortisol,
Oh, right, cortisol.
which is a glucocorticoid made by the adrenal glands.
I remember learning about that.
And just like cortisol, hydrocortisone interacts with these glucocorticoid receptors,
Uh-huh.
which are pretty much in every cell in the body.
Wow. So it has, like, widespread effects?
It really does.
Yeah, I mean, people use hydrocortisone for everything from, like, skin rashes to really serious allergic reactions.
Yeah, it's incredibly versatile.
But how does it work exactly? Like, how does mimicking cortisol actually reduce inflammation and suppress the immune system?
Okay, so it's pretty complex, but basically, when hydrocortisone binds to those glucocorticoid receptors, It starts this whole chain reaction that affects gene expression,
Whoa.
which can then decrease the production of these inflammatory mediators, those signaling molecules that cause all the swelling, redness, and pain.
So it's not just covering up the symptoms, it's actually working at like a deeper level to change the body's inflammatory response.
Exactly. It's working at the source.
That's pretty amazing. And that's why it's so useful for all these different conditions like adrenal insufficiency, severe allergies, and autoimmune diseases like rheumatoid arthritis.
Right. It's got a huge range of uses.
But of course, it's a powerful medication.
It is.
So you shouldn't just use it whenever you feel like it.
No, definitely not.
And I know long-term use can increase the risk of things like osteoporosis and even adrenal suppression, right?
Yeah, that's right.
And it can also lead to that redistribution of fat, particularly in the face and abdomen, which is a classic sign of Cushing's syndrome.
Right. And that's another thing to be aware of with long-term hydrocortisone use.
And another important point is that you have to taper the doses gradually when you're stopping hydrocortisone.
That's super important.
So you can't just stop cold turkey. What happens if you do?
Well, if you stop suddenly, it can lead to adrenal insufficiency,
Oh.
which means your body can't make enough cortisol on its own.
Oh, that sounds bad.
Yeah, it can be really serious, even life-threatening in some cases. So that's why it's super important to work with a doctor to gradually lower the dose over time. This gives the adrenal glands a chance to get back to their normal function.
Okay, so this is all great information. We've gone from the nervous system with naloxone to the endocrine and immune systems with hydrocortisone.
It's amazing how many systems are involved, right?
It is. So for our last stop in this first part of our deep dive, let's shift gears and talk about oxytocin.
Oxytocin, the love hormone.
That's the one. So it's often associated with love and bonding.
It is, but it's so much more than that.
Yeah, it's pretty multifaceted, right?
Absolutely. It's
Yeah.
best known for its role in childbirth and breastfeeding, but it really does so much more.
You know, I've heard it called the love hormone because it might be involved in things like social bonding and trust.
Right?
Is that accurate?
Yeah, there's more and more evidence suggesting that oxytocin is involved in social behavior, pair bonding, and maybe even reducing anxiety.
Wow, that's pretty amazing.
But let's start with its role in childbirth, because that's probably what it's most known for.
Okay, so what's going on with oxytocin during labor?
All right, so during labor, oxytocin acts on receptors in the uterus. It stimulates those powerful contractions that help push the baby through the birth canal.
Right.
In fact, they often use synthetic oxytocin, which is called pitocin,
I've heard of that.
to induce labor or make contractions stronger if they're not strong enough on their own.
So it's like giving the body a little extra help to get things going?
Exactly. But too much oxytocin can be a problem.
Oh, right, because I've heard that it can be dangerous if there's too much.
Yeah, too much can cause something called uterine hyperstimulation,
Mm-hmm.
which means the contractions get too frequent or too intense.
Oh, I see.
And that can put stress on the baby and even cause complications.
So it's like a powerful tool, but it needs to be used carefully.
Absolutely. Careful monitoring is super important when using oxytocin during labor.
Makes sense. So after the baby is born, oxytocin keeps on working, right?
It does.
It's also involved in breastfeeding.
Exactly. It's responsible for the milk ejection reflex, also known as the letdown reflex.
I've heard of that.
So when a baby suckles at the breast,
Yeah.
it triggers the release of oxytocin,
Mm-hmm.
which causes the muscles around the milk ducts to contract.
Oh, so it's like squeezing the milk out?
Pretty much, it pushes the milk out for the baby to feed.
It's amazing how this one hormone can do all that, orchestrate such complex processes in childbirth and breastfeeding.
It really is remarkable.
It is. But I'm also curious about its role in social behavior. We talked about how it might be involved in trust and bonding.
Right.
So what's the connection there?
Well, studies have shown that oxytocin levels go up during social interactions, especially with people we're close to.
So like cuddling with your partner or playing with your dog could actually increase oxytocin levels.
It's definitely possible. And some research even suggests that oxytocin might help reduce anxiety and make us feel calmer and happier.
Oh, wow. That's really cool.
It is. So you've got this one hormone that's involved in labor, breastfeeding, and even our social and emotional lives.
It's like a key player in all these different aspects of being human.
It really is.
Yeah.
And it shows just how connected our physical, emotional, and social well-being are.
I totally agree. So there you have it. Naloxone, hydrocortisone, and oxytocin, 3 totally different medications.
Right.
But they all work in such amazing ways, and they highlight the intricate interplay of all of the body's systems.
Yeah, it's like a delicate dance between all these different parts.
Exactly, and there's so much more to learn about them, too.
It really is. Stay tuned for part 2, where we're going to go even deeper into the world of pharmacology.
That's right. We'll explore the nuances of these medications and how they're used to treat a whole range of conditions.
It's going to be fascinating.
It is, so make sure you join us for part 2 of our deep dive.
We'll see you there. All right, welcome back to the show.
I'm ready for more.
So as we dive deeper into these 3 medications, I think it's really important to appreciate not just what they do,
Right.
but how they do it,
Oh, yeah, the how is always fascinating.
Exactly. So we talked about how naloxone, hydrocortisone, and oxytocin all work by interacting with those specific receptors.
Right, the lock and key thing.
That's right.
Yeah.
But that interaction is just the first step in a pretty complex journey,
Okay, so what's the next step then?
Well, next up is pharmacokinetics.
Pharmacokinetics. Remind me what that means again.
Basically, it's the study of how the body processes a drug.
Oh, okay.
So it looks at things like absorption,
Mhm.
distribution, metabolism, and excretion.
Oh, right, I remember that now. Or ADME for short.
Exactly. ADME. That's a good way to remember it.
It is. So it's not just about getting the drug into the body.
Wait,
It's
wait.
about what happens to it once it's in there.
Exactly. Like, think about naloxone for a second.
Okay.
We talk about how it can be given intravenously, intramuscularly, or intranasally.
Right, the different ways to give it.
And each of those routes is going to affect how quickly naloxone gets absorbed into the bloodstream
Oh, that makes sense.
and how quickly it gets to those opioid receptors in the brain, which is the whole point.
Totally. So intravenous is the fastest.
Intravenous is like, boom, right into the system almost immediately.
Okay.
That's why it's the go-to for emergencies.
Makes sense.
But, intramuscular and intranasal take a bit longer.
But they're more practical in certain situations, right?
Yeah, for sure. Like, if a bystander needs to give someone naloxone during an overdose, a nasal spray is way easier than trying to find a vein,
Right, good point.
And then there's distribution.
Okay, what's that?
That's how the drug spreads through the body.
Oh, okay.
So naloxone, for example, it can cross the blood-brain barrier,
Uh-huh.
which is super important because that's how it gets to those opioid receptors in the brain.
So the blood-brain barrier is like, a security checkpoint,
Exactly.
and only certain molecules get a VIP pass to get through.
Uh-huh. I like that.
Okay.
And, not all drugs can cross that barrier, which can limit how well they work for certain conditions.
Right, that makes sense. So after the drug is distributed throughout the body, what happens next?
Well, then you've got metabolism, which
Mm.
is breaking down the drug into metabolites.
Mhm.
Usually happens in the liver.
Okay.
And then finally, you've got excretion, which is how the body gets rid of the drug and its metabolites, usually through the kidneys and out in the urine.
So it's like a whole journey from getting in to getting out.
It really is a complex journey.
And each step of that journey can affect how effective and safe the drug is, right?
That's exactly right. So, for example, think about hydrocortisone.
Okay.
We know it acts like cortisol,
Uh-huh.
which is a natural hormone with a whole feedback loop involving the hypothalamus, the pituitary gland, and the adrenal glands.
Oh, right, the whole HPA axis thing.
Exactly. So when you take hydrocortisone, especially for a long time,
Yeah.
it can mess with that delicate balance
Uh-oh.
and lead to adrenal suppression.
That's why it's so important to taper the doses, right? To give
Yeah.
those adrenal glands time to, wake up and start making cortisol again on their own.
You got it.
Yeah.
And understanding how hydrocortisone works in the body, like its pharmacokinetics,
Uh-huh.
can really help us minimize the risk of that side effect.
Okay, good to know. So what about oxytocin? How is it different?
Well, oxytocin is a peptide hormone, which means it's made up of amino acids, and it gets broken down pretty quickly in the body.
So it has a shorter half-life than something like hydrocortisone.
Exactly. Shorter half-life means you need to give it more often to keep it working.
Makes sense.
Like during labor, oxytocin is often given as a continuous intravenous infusion.
Oh, so it's like a constant drip to, keep things moving along.
Precisely. And this brings up another important concept, the therapeutic window.
The what?
The therapeutic window.
I haven't heard that.
It's basically the range of drug concentrations in the blood that give you the effect you want without causing too many side effects.
Oh, okay, that makes sense.
Like with oxytocin, you need to find that sweet spot
Yeah.
where it's stimulating those uterine contractions effectively,
Uh-huh.
but not causing hyperstimulation.
Yeah. So too little oxytocin and labor might stall,
Could happen.
but too much and you risk complications.
Exactly. Finding that balance is all about understanding how the drug works in the body, its pharmacokinetics,
Right.
and then tailoring the dose and how it's given to each individual patient.
That makes a lot of sense. So we've got absorption, distribution, metabolism, and excretion. They all work together to determine a drug's journey through the body.
Yeah, it's a team effort.
It is. But we haven't really talked about drug interactions yet. How does understanding pharmacokinetics help us avoid those?
That's a really important question. Some medications can actually interfere with each other's pharmacokinetics.
Oh, wow. How?
So some meds can either inhibit or induce enzymes in the liver
Hmm.
that are responsible for metabolizing other drugs.
Wait, so one drug could make another drug metabolize faster or slower?
Exactly.
That's kind of scary.
Yeah, and that can either make the drug less effective or increase the risk of side effects.
Oh, wow.
Like some antibiotics can interfere with the metabolism of hydrocortisone, and that can potentially increase the levels of hydrocortisone in the blood
Oh, no.
and increase the risk of side effects.
So that's why it's so important to tell your doctor about all the medications you're taking.
Right, even over-the-counter stuff and supplements.
Everything.
It's super important for avoiding those potentially dangerous interactions.
Makes sense. Speaking of safety, let's talk about adverse reactions.
All right, adverse reactions.
Because even with all this knowledge about how drugs work in the body
Yeah.
and how to get the dosing right, no medication is totally risk-free.
Unfortunately, no.
Yeah.
Every medication has some potential for side effects.
Right. We've already talked about some of the potential adverse reactions with these medications, like opioid withdrawal symptoms with naloxone,
Yeah.
Cushing's syndrome with long-term hydrocortisone use, and
Right.
uterine hyperstimulation with oxytocin.
Uh,
But there are always those rarer side effects that can pop up,
Yeah.
right? Things you might not even think about.
oh, absolutely. There are
Yeah,
always
yeah.
those rare cases.
Yeah.
Like with naloxone, there have been reports of pulmonary edema.
What's that?
It's a buildup of fluid in the lungs.
Oh, wow. That doesn't sound good.
It's not, but it's rare. And there have even been reports of seizures with naloxone.
Really? That's scary. I wouldn't have expected that from a medication that's supposed to reverse an overdose.
It just goes to show that even life-saving medications can have downsides.
Right.
And it emphasizes how important it is to monitor patients carefully and weigh the risks and benefits.
That's a good point. And with hydrocortisone, long-term use can also increase the risk of osteoporosis, of vascular necrosis, and even psychiatric problems like mood swings or psychosis.
Right, those are all important considerations.
And it's important to remember that even stopping hydrocortisone suddenly can be dangerous
Absolutely.
because it can lead to adrenal insufficiency.
It's like we said before, even discontinuing a medication sometimes has to be done strategically with a doctor's supervision.
Right, it's not always as simple as just stopping the pills.
Not at all.
Yeah.
And with oxytocin, one of the lesser-known risks is water intoxication.
Water intoxication. I thought water was good for you.
It is in moderation,
Oh.
but too much water can actually dilute the electrolytes in your blood,
Oh, wow.
and that can lead to confusion, seizures, even coma.
That's a good reminder that even natural hormones can have downsides if they're not used carefully.
Exactly.
Yeah.
So as we've been talking about pharmacokinetics and adverse reactions,
Uh-huh.
I think the main takeaway here is that medications are powerful tools,
They are.
but they need to be used responsibly
Right.
and with a clear understanding of both the good and the bad.
The benefits and the risks.
Exactly. And that's where doctors and other healthcare providers play such a crucial role.
Absolutely. They're the ones who can figure out the right medication, dose, and how to give it, and they can monitor for any problems.
Right. But it's a two-way street.
Oh, yeah, for sure.
Patients need to be proactive too.
Absolutely. We have to take responsibility for our own health.
Exactly. Patients can empower themselves by asking questions, advocating for their own well-being, and being honest with their doctors about everything they're taking.
Yeah.
You know,
Yeah, I love that it's a partnership, really.
it is a collaboration.
Right. So, before we move on to the last part of our deep dive,
Okay.
I want to connect this back to what we were talking about at the beginning, how all the body systems are interconnected.
Yeah, that's a good point.
It's amazing how naloxone, hydrocortisone, and oxytocin, they all seem to target different systems,
They do.
but they show us just how intricately our bodies are connected.
It's like a web. Everything is linked.
It is. We've seen how naloxone targets the nervous system,
Uh-huh.
hydrocortisone affects the endocrine and immune system,
Right.
and oxytocin influences the reproductive and endocrine systems.
It's like a beautiful orchestra with all these different instruments playing together.
That's a great way to put it. And understanding these connections can help us understand how medications work,
Yeah.
why they're used for certain conditions, and what side effects to watch out for.
It's all about seeing the body as a whole rather
Mhm.
than just a bunch of separate parts.
Right, a holistic perspective.
Exactly. And that's a powerful way to think about health, not just for healthcare professionals, but for everyone.
I totally agree. Ready for part 3?
Let's do it.
All right, welcome back to the final part of our deep dive.
Part 3 already. Wow.
I know, right? Time flies when you're having fun with pharmacology.
It really does.
So, as we wrap things up,
Uh-huh.
I've been thinking about how each of these medications,
Yeah.
in its own way, it shows how incredible medical science can be.
Oh, for sure.
You know, it's like we've learned so much about the body,
Right.
and we're able to create these medications that can really make a difference.
I mean, what's really fascinating is
Yeah.
that while these meds target very specific things like systems and receptors,
Uh-huh.
they actually tell a much bigger story. You know?
Okay, I'm listening.
It's like this intricate dance between our biology, our chemistry, and even our behavior.
Wow, that's a great way to put it.
Right? It's all connected.
I totally agree. It's like, you know those choose your own adventure books we read as kids?
Oh, yeah. I love those.
Where each choice leads to a different outcome?
Uh-huh.
It's kind of like that with these medications, you know?
Okay. Yeah, I see what you mean.
We're choosing a path to influence a certain biological process,
Right.
whether it's reversing an overdose, controlling inflammation, or even changing social behavior.
Yeah, it's like we're hacking the system in a way.
In a good way, though.
Oh, definitely.
Yeah.
But each path has its own risks and benefits, right?
Of course.
That's why it's so important to understand pharmacology.
Yeah, so we can make informed decisions.
Exactly. Like, when should we intervene? Which medication should we use? How can we maximize the good stuff and minimize the bad?
Right, it's all about making those smart choices.
Exactly.
So we've talked about mechanisms of action, pharmacokinetics, adverse reactions.
Yeah, we've covered a lot of ground.
We have. But what I'm really excited about is, like, the future of all this.
Oh, yeah. The possibilities are endless.
They are. You know, what new discoveries are going to be made? What new applications will we find for these medications?
I mean, as we learn more about the body,
Mm-hmm.
we get better and better at developing targeted and effective therapies.
That's so cool. Like, for example, I read that researchers are looking into using naloxone for more than just overdoses.
Oh, really?
Yeah, they're thinking about using it as a potential treatment for alcohol use disorder.
Wow, that's interesting. But wait, how would that even work? Naloxone targets opioid receptors, right? How would that help with alcohol?
That's what I thought too, but apparently there's some research suggesting that naloxone might also block the release of endorphins.
Endorphins.
Yeah, those feel-good chemicals that are released when you drink alcohol.
Oh, I see.
So the idea is that by blocking those endorphins,
Uh-huh.
naloxone could reduce the pleasurable effects of alcohol.
And maybe even help with cravings.
Exactly. It's still early, but it's definitely an exciting avenue of research.
It really is. New treatments for alcohol addiction are definitely needed.
Couldn't agree more. So what about hydrocortisone? Anything new and exciting happening there?
Well, one area that's really promising is the development of more targeted drug delivery systems.
Oh, interesting. So like ways to deliver hydrocortisone directly to the site of inflammation.
Exactly, like to a specific joint or a patch of skin.
So you wouldn't have to take it orally or intravenously,
Right.
and you could avoid those systemic side effects, especially with long-term use.
Exactly. It would be a huge benefit for people with conditions like rheumatoid arthritis or inflammatory bowel disease.
Yeah, those are the people who often need to take hydrocortisone for a long time.
They are. So more targeted therapies would be a game changer for them.
For sure. And what about oxytocin? Where do we go from here with the love hormone?
Well, there's a lot of research going on about its role in social bonding, trust, and even autism spectrum disorder.
I'm so fascinated by that.
Yeah, it's a really interesting area.
We've talked about oxytocin as the love hormone, but could it also help us understand and maybe even treat some of these complex social and emotional conditions?
I mean, that's the hope.
That would be amazing.
It would. Researchers are actually looking into using oxytocin nasal sprays to improve social skills and reduce anxiety in people with autism spectrum disorder.
So it's like giving the brain a little boost of social confidence.
Yeah, something like that.
Hmm?
The research is still ongoing, but it's definitely promising.
It is. It's like there's always more to learn, always something new to discover.
It's the beauty of science, right?
It is. So as we wrap up our deep dive,
Yeah.
I'm just in awe of how complex and amazing the human body is.
Me too. And it's amazing how much we've learned about how to interact with it.
It is. But there's still so much more to learn.
Oh, absolutely.
Uh,
This is just the tip of the iceberg.
it is. So any final thoughts before we sign off?
Let me think. You know, if we go back to the beginning,
Mm.
those 3 medications, Naloxone, hydrocortisone, oxytocin.
Yeah, they seem so different.
They do. What do you think the common thread is between them?
That's a good question. I think the common thread is that they all show us how interconnected our physical, emotional, and social well-being really are.
That's a great insight. It's all connected, and that's something we need to keep in mind, both in medicine and in life.
Absolutely. So it looks like we've reached the end of our deep dive.
We did it.
We did. Thanks for joining us on this incredible journey into the world of pharmacology.
It's been a pleasure.
It has. And remember, keep those brains engaged and those curiosities piqued.
Always be learning.
Exactly. Until next time.
See you then. Hey, everyone, and welcome back for another deep dive.
It's great to be back.
Today, we're taking a closer look at a topic you guys know well, nausea.
Ugh.
And we've got not one, but two medications to sort of break down and compare and contrast.
Yeah, and these are big ones.
They are big ones.
Mm-hmm.
These are ondansetron and dimenhydrinate.
Two different approaches to the whole nausea thing.
Yeah, so before we even, get into the specifics of each one, can you just give us, the high-level overview of why these two are so different?
Sure. So think of it like this ondansetron is like a precision strike.
Okay.
It goes right to the source of nausea in many cases and shuts it down.
Okay.
Dimenhydrinate, on the other hand, is more like a multi-tool. It's got a broader approach and tackles nausea from a few different angles.
Okay. I'm already intrigued. So let's dive into ondansetron first.
Sounds good.
One thing that stood out to me in the research is that it's often used for nausea caused by, chemo and radiation.
Right. That's because those treatments can really mess with your serotonin levels. Ah, serotonin. Okay.
Yeah, and
Right.
serotonin is a major player in that whole nausea and vomiting reflex.
So is ondansetron like blocking the serotonin or something?
Exactly. It's a serotonin receptor antagonist,
Okay.
which means it basically blocks serotonin from binding to those receptors in your gut and brain.
So it's like intercepting the signal that would normally make you feel nauseous.
Precisely.
Yeah.
And that's why it's so effective for those tough cases where nausea is really intense.
That makes sense. And what about how quickly it works? If you're feeling really awful, how long does it take to kick in?
Well, that depends on how it's administered.
Okay.
If you get it through an IV, it can work within minutes.
Wow.
Yeah, like 15 minutes or even less.
Yeah.
But if you take it orally, it'll take about 30 minutes to start feeling the effects.
Okay. So not as immediate, but still pretty fast.
Right. And those effects typically last for 4 to 8 hours.
Okay. That's good to know. Now, one thing that kind of jumped out at me was this potential side effect called QT prolongation.
Yeah, that's one to be aware of.
It sounds kind of scary. Honestly, I have no idea what that even means.
Basically, it means the drug can, in some cases, affect the heart's electrical activity.
Okay.
And that can lead to an irregular heartbeat, which is obviously not a good thing.
So is it like a common side effect? Or something that only happens in certain people?
It's not super common, but it's a risk that doctors definitely consider,
Okay.
especially for patients who already have heart conditions.
Right. So it's like a powerful drug, but it comes with some potential risks.
That's a good way to put it.
And what about other side effects? Are there any common ones to watch out for?
The usual suspects are things like headache, constipation, fatigue,
Okay.
the typical medication side effects.
Right. Nothing too out of the ordinary.
And they're usually pretty mild.
So overall, it sounds like ondansetron is like a real heavy hitter in the nausea fighting world.
It definitely is.
Yeah.
It's a valuable tool for managing those really tough cases of nausea.
All right. So now let's switch gears and talk about dimenhydrinate.
Okay.
This one seems a lot different from ondansetron.
It is. It's more of a combination approach.
How so?
Well, it actually contains two main ingredients. Diphenhydramine, which is an antihistamine,
Okay.
and theophylline, which is a stimulant.
Wait, a stimulant? Isn't that going to make you feel more jittery?
You think so, right?
Yeah.
But the theophylline is there in a low dose to counteract the drowsiness from the diphenhydramine.
So it's like they balance each other out.
Exactly. You get the benefits of the antihistamine without feeling totally knocked out.
Okay. That's pretty clever. So how does the antihistamine part help with nausea?
Well, histamine plays a role in motion sickness and vertigo.
So it's not just for allergies.
Nope. It's got a few different functions in the body.
Interesting. So dimenhydrinate is basically blocking those histamine signals that contribute to feeling nauseous.
Precisely.
Okay, I'm starting to see how this one works. So what kind of nausea would you typically use dimenhydrinate for?
It's a classic for motion sickness.
Ah, makes sense.
Yeah, and vertigo too.
Oh.
And it can also be used for general nausea,
So it's kind of like an all-around nausea reliever.
right? It's not as targeted as ondansetron,
Yep.
but it can be really helpful for those more common types of nausea.
And what about side effects? Any common ones with dimenhydrinate?
Drowsiness is the big one,
Yeah.
even though it has that stimulant in it.
Really?
Yeah. It can still make you sleepy,
Yeah.
especially if you take too much.
Okay, so maybe not the best choice if you need to be alert.
Right. Other common side effects are dry mouth and blurry vision.
Okay. And are those also related to the antihistamine part?
Yep. They're all due to the anticholinergic effects of the drug.
Anticholinergic effects.
Yeah. It means the drug is blocking a neurotransmitter called acetylcholine, which is involved in all sorts of bodily functions.
Okay, so blocking acetylcholine can lead to those side effects.
Exactly.
This is getting pretty complex.
It is.
Yeah.
But it's fascinating stuff, right?
It is. I'm learning a lot.
You too.
Okay, so we've got ondansetron, the precision striker, and dimenhydrinate, the multi-tool.
Like that analogy.
Now, I'm curious, in what situations would you choose one over the other?
That's a great question. And it's one we'll explore in more detail when we come back after the break.
Sounds good. I'm ready to put these two meds head to head.
Me too.
We'll be right back.
Stay with us.
Hmm?
Okay, so you're ready to put these nausea meds head to head?
I am. Let's play a little game.
Okay, I like games.
Let's call it ondansetron versus dimenhydrinate.
Catchy.
So I'm going to give you a scenario, and you tell me which med you'd reach for.
I'm game.
All right, first scenario, you're about to go on a roller coaster.
Oh, boy. Okay, so we're talking motion sickness here.
Yep.
I'd definitely go with dimenhydrinate for that one.
Yeah, I think that's the classic roller coaster remedy.
Exactly. It's all about preventing that woozy feeling before it even starts.
And you wouldn't want ondansetron making you drowsy on a roller coaster.
No,
Yeah.
definitely not. That could be a recipe for disaster.
All right, next scenario. You're prepping for a big presentation at work, and suddenly you're hit with a wave of nervous nausea.
That's a tough one. I'd probably still lean towards dimenhydrinate.
Really? Why not ondansetron?
Well, it's just a milder case of nausea, I think. And dimenhydrinate is more readily available over the counter.
That's a good point. Plus, you don't want to risk any potential heart issues from ondansetron for something like pre-presentation jitters.
Exactly. It's all about weighing the risks and benefits.
Okay, next scenario. You're undergoing chemotherapy.
All right, now we're talking serious nausea.
Yep. This is where ondansetron shines.
Absolutely. Chemo-induced nausea can be incredibly intense, and ondansetron is specifically designed to tackle that.
It's like the big guns of nausea med.
Precisely.
Ugh.
It blocks those serotonin signals that are going haywire during chemo.
So even though it has that potential side effect of QT prolongation,
Right. In that situation, the benefits likely outweigh the risks.
because you really need something strong to combat that level of nausea.
Exactly.
Okay, last scenario. You just had surgery and you're feeling nauseous.
Ooh, that's another one for ondansetron.
Yeah, I agree. Post-surgical nausea can be pretty rough.
It can. And ondansetron can help get it under control quickly.
So it seems like ondansetron is the go-to for those more severe cases of nausea.
Yep. When you need fast and effective relief, ondansetron is often the best choice.
And dimenhydrinate is more for everyday nausea, like motion sickness or mild queasiness.
Exactly. It's a good all-rounder for those less intense situations.
This has been really helpful. I feel like I have a much better understanding of when to use each medication.
I'm glad to hear that. That's what we aimed for.
And I think it's important to remember that this is just a general overview.
Absolutely. You should always talk to your doctor or pharmacist.
Right. They can help you decide which medication is right for you.
And they can also make sure you're aware of any potential interactions with other medications you might be taking.
So don't self-medicate.
Nope. Always consult with a healthcare professional.
All right, so we've covered a lot of ground today. But before we wrap up this deep dive, I want to leave our listeners with one final thought.
Okay, I'm all ears.
We've focused on ondansetron and dimenhydrinate today,
Right.
but there are actually a lot of other options out there for managing nausea.
That's true. There's a whole arsenal of anti-nausea medications available.
And they all work in slightly different ways.
Yep. Some target different receptors in the body. Some are combinations of different drugs.
So if one medication doesn't work for you, don't give up hope.
Exactly.
Yeah.
There might be another one out there that's a better fit,
And don't forget about non-medication approaches.
like ginger or peppermint.
Exactly.
Yeah.
Those can be really effective for some people.
It's all about finding what works best for you.
So keep exploring, keep learning, and keep talking to your healthcare providers.
Well said. That's the best advice we can give.
Thanks for joining us for another deep dive,
It's been a pleasure.
and we'll see you next time.
Bye, everyone.
All right, so we've explored a lot about ondansetron and dimenhydrinate.
We have really dug deep into how they work, their strengths, their weaknesses.
Yeah, and I think it's important for people to realize that they're not the only options out there.
Oh, absolutely. There's a whole range of anti-nausea medications available.
And they all work in different ways, you know,
Yeah, targeting different receptors in the body.
combining different mechanisms.
And even some natural remedies, too,
Exactly. Like ginger and peppermint.
which can be surprisingly effective for some people.
It's really all about finding what works best for you as an individual.
Exactly. Your body, your needs.
And I think that's a really important takeaway from this whole deep dive.
Absolutely. There's no one-size-fits-all solution when it comes to managing nausea.
Right. So if one medication doesn't work or has side effects you can't tolerate.
Don't give up hope. There are other options out there.
Yeah. And don't be afraid to advocate for yourself.
Talk to your doctor. Talk to your pharmacist.
They can help you navigate all the choices and find the best solution for you.
They're your partners in this journey.
And remember, knowledge is power.
Absolutely.
Right?
The more you understand about your body and about the medications available.
The better equipped you'll be to make informed decisions about your health.
So keep learning. Keep asking questions.
And keep exploring.
We'll be here with more deep dives to guide you along the way.
But for now, thanks for joining us.
It's been a pleasure.
And we'll see you next time.
Bye, everyone.
Welcome to our deep dive. Today we're going to be looking at some medications that are pretty commonly prescribed.
Yeah.
We're going to be talking about inflammation, psychosis, allergies, even some stuff to do with like your stomach digestion, all that kind of stuff. And the goal is to, give you guys some knowledge to understand your own health a little better.
Yeah.
Or even just like, have better conversations with your healthcare providers, right?
Absolutely. I think it's really important to not just know the name of the medication, but kind of understand what it does to your body. Like, what are the positive effects, but then what are some, potential downsides or things to be aware of?
For sure, for sure. So we've got all kinds of stuff to guide us here. We've got some research articles, we've got some drug overviews, really just trying to get like a comprehensive picture of these different drug classes. So let's just jump right into it, I guess. And I think the medications that we probably reach for the most are anti-inflammatories.
Right.
So, when I'm looking at our sources here, the three main types that stand out are NSAIDs, DMARDs, and biologics.
So think of NSAIDs as like your over-the-counter kind of heroes for everyday aches and pains, your ibuprofen, your naproxen, even good old aspirin. They all fall into this category.
Okay.
And they basically work by blocking these enzymes called KOX enzymes.
KOX enzymes, what are those all about?
Yeah, so KOX enzymes, there's actually two types. There's KOX1 and KOX2. And it's important to kind of understand these because it's all about how these NSAIDs work. So KOX1, think of it as like the diligent worker, keeps things running smoothly, in your stomach, your gut.
Okay.
KOX2 is more like the overzealous party animal, kind of causes trouble when inflammation's going on.
Gotcha.
So NSAIDs are trying to calm things down, but sometimes they accidentally, dampen the responsible worker's enthusiasm too.
Okay.
And that's why long-term use of these NSAIDs can lead to ulcers and other gastrointestinal issues. So it's that classic example of how even common drugs, right, have trade-offs. They're not, perfect.
Gotcha. So popping an ibuprofen every now and then is probably fine. But if you're someone who's dealing with like chronic pain, it sounds like it's important to talk to a doctor about maybe some safer long-term options.
Right, for sure.
So now what about these DMARDs? Those seem to work a little differently.
Yeah, DMARDs are more about like modifying the immune response rather than just masking symptoms.
Okay.
So a good example here would be methotrexate. And you might be surprised to know that this is used for both rheumatoid arthritis and some types of cancers.
Wait, the same drug for arthritis and cancer? That's kind of wild.
I know, right? It is. And essentially it works by interfering with cell growth.
Okay.
So for cancer, this helps to kind of slow down that growth of the tumor. And for rheumatoid arthritis, it kind of puts the brakes on those overactive immune cells that are attacking the joints.
So it's like this powerful tool that can be used in different ways.
Exactly. But like with any powerful tool, there's potential risks. So with methotrexate, those risks can be similar to what you see with chemotherapy. So regular monitoring is key to make sure you're safe while you're on this powerful medication.
That makes a lot of sense. It's important to be aware of those potential side effects and, definitely talk to your doctor.
Absolutely.
Okay, last but not least, we have these biologics. These sound like something straight out of like a science fiction movie or something.
Right. They do sound kind of futuristic, but these biologics are highly targeted, almost like these tiny smart bombs that go and seek out specific parts of the immune system to kind of help reduce inflammation. And a lot of people have probably heard of Humira.
Right.
That's a good example of a biologic.
Yeah, yeah, I've
Yeah.
seen those commercials. What makes these biologics so different than like the other types of anti-inflammatories that we were just talking about?
Yeah, so Humira, it's also known as adalimumab, and it specifically targets this protein called TNF-alpha. And this protein plays a huge role in inflammation, so it's kind of like quieting down the conductor of the orchestra.
Oh.
By blocking TNF-alpha, Humira basically reduces that overall inflammatory response.
Oh, wow. So it's not just like masking the symptoms, it's actually addressing like the root of the problem.
Right.
That's pretty impressive. But I imagine there's downsides to this as well.
There are. So because it's suppressing the immune response, there's a higher risk of serious infections
Okay.
while you're taking a drug like Humira. So patients need to be screened for infections before they even start this treatment, and they need to be extra vigilant about staying healthy
That makes sense. That makes
while
sense.
they're on the medication.
It sounds like, wow, choosing the right anti-inflammatory medication
Mhm.
is a complex decision. There's a lot to think about.
Absolutely. And this is something that's really important to remember. We're just scratching the surface here.
Yeah.
This is just for informational purposes.
Exactly. Consult with your doctor before making any decisions about your health.
Always.
All right, so now that we've kind of tackled those everyday aches and pains, let's move on to a category of drugs that might seem a little more complex, medications that are used to manage psychosis.
Yeah, this is a topic that I think often carries a lot of stigma with it.
Yeah.
But hopefully by understanding how these drugs work, we can kind of approach mental health with more empathy and informed perspectives.
Absolutely. And to be clear, our focus here is solely on the medications themselves,
Right.
not on diagnosing or treating mental health conditions.
Right. We're just focused on the pharmacology today.
Exactly, exactly. So when looking at our sources here, I'm seeing two main categories. We've got first generation antipsychotics, also called, typical antipsychotics, and then we've got second generation or atypical antipsychotics.
Mm.
So haloperidol would be an example of the first generation, and then risperidone would be an example of a second generation medication.
Yeah.
So what's like the main difference between those two?
So both of them actually target dopamine, and this is a neurotransmitter that's involved in mood regulation.
Okay.
However, the second generation antipsychotics also have an effect on serotonin, which is another neurotransmitter in the brain.
Okay.
And this difference is thought to be why they're more effective at managing not only like the more obvious symptoms of schizophrenia, like hallucinations,
Right.
but also the less obvious ones, like, social withdrawal and those kinds of things.
Okay, so it's addressing a broader range of symptoms.
Exactly.
One thing that's really jumping out at me, though, is like the difference in potential side effects.
Mm-hmm.
The first generation antipsychotics seem to carry a higher risk of movement disorders.
That's right. And one that is particularly serious is called tardive dyskinesia. And this can cause involuntary repetitive movements, often in the face, the tongue,
Oh, wow.
and it can even be irreversible.
Yeah.
So this highlights the fact that, interfering with dopamine, which is involved in motor control, can have some very serious and long-lasting consequences.
Yeah, that's definitely something to consider. And then on the other hand, the second generation
Right.
antipsychotics seem to come with a different set of risks.
Yes. So these ones tend to cause more metabolic problems, weight gain, blood sugar spikes.
Oh, wow.
Not something you typically associate with a medication for mental health, but it's a very real concern.
It's a good reminder that all medications have potential side effects, and those side effects can vary depending on the specific drug.
Exactly. And it really underscores the importance of having that open communication with your healthcare provider, weighing the potential benefits against the risks, and finding the best treatment plan for your individual needs.
So it's like with both generations of these medications, there's this balancing act
Right.
between managing symptoms and then also trying to minimize these potentially serious side effects.
Precisely. It's not a one-size-fits-all approach,
Hmm.
and that's why careful monitoring and personalized treatment plans are so crucial.
This information can feel a bit heavy, but I think it's important to be aware of the potential downsides of any medication,
For sure.
not just those for mental health conditions. It's all about making informed decisions.
Absolutely. It's also a good reminder to be critical of how medications are portrayed in the media, which often doesn't show the whole picture.
I completely agree. Now let's switch gears and talk about something we can all relate to, allergies.
Okay.
Those sniffles and sneezes that plague so many of us, especially during certain times of year?
Allergies are certainly a common ailment, and thankfully we have medications like antihistamines that can help us manage those symptoms.
Right. Antihistamines, I feel like these are like the everyday heroes that we often kind of take for granted.
Yeah,
And they're not just for allergies either. Like I've even used them for motion sickness before.
it's true. Antihistamines are quite versatile, but let's start with the basics. Just like with the antipsychotics, you have first generation and second generation
Huh.
antihistamines. So Benadryl or diphenhydramine, that's your classic example of a first generation antihistamine.
Gotcha.
And then Claritin or loratadine, that represents the second generation.
Okay, so what makes those two generations different? Because I know like with Benadryl, that stuff always makes me sleepy, but I can take like a Claritin during the day and not feel like I need to take a nap.
Yeah, so first generation antihistamines like Benadryl can cross the blood-brain barrier. So think of this as like a bouncer at a nightclub.
Okay.
Carefully selecting who gets in, Benadryl gets past the bouncer, causes drowsiness.
Wow, okay.
Second generation antihistamines like Claritin, they were designed to be less likely to get past that bouncer.
Right.
So they stay out of the brain and don't make you sleepy.
Gotcha. So it's all about how easily those medications can enter the brain.
Exactly.
Okay, speaking of breathing easy, let's explore those medications that can help people with conditions like asthma, manage their airways, talking about bronchodilators and other respiratory medications.
Right.
This could be like true lifesavers for some folks.
They really can.
Yeah.
And just like the medications we've already discussed, there are different types of respiratory medications, each with their own kind of way of working and things to consider.
All right, so let's break it down. When I'm looking at our research here, I see kind of two main players. We've got beta agonists, and then we've got inhaled corticosteroids.
Mm.
And I know like albuterol is a common beta agonist that's often used in those rescue inhalers, for asthma attacks and things like that.
Right. So beta agonists like albuterol provide quick relief by relaxing those muscles in the airways and making it easier to breathe.
Okay.
Inhaled corticosteroids, on the other hand, they focus more on reducing inflammation in those airways so they don't work as quickly. But over time, they can really help prevent those asthma attacks from even happening in the first place.
So it's like a two-pronged approach. You've got the beta agonists for like immediate relief, and then you've got inhaled corticosteroids for kind of that long-term management.
Exactly.
I'm guessing there's potential downsides to consider with both types.
So with the beta agonists, the side effects are mostly related to their stimulating effects. So you might see things like increased heart rate, maybe some tremors, but these are usually pretty mild and temporary, especially when the medication is inhaled.
Okay.
Inhaled corticosteroids, on the other hand, have some different concerns.
Yeah, I've heard that using those inhaled corticosteroids long-term can have some pretty unpleasant side effects. Is that true?
Yeah, it's true that they can cause some side effects, especially with long-term use. So one of the most common ones is oral thrush,
Okay.
which is basically a fungal infection in the mouth.
Mm-hmm.
You might also see things like a hoarse voice, a cough, and in some cases even bone thinning if used for a very long time.
Wow.
Yeah.
It sounds like managing chronic respiratory conditions can be a complex balancing act.
It really can be. And it really emphasizes how important it is to work closely with your healthcare provider to find that right balance of medications and to make sure any potential side effects are minimized.
Okay, that makes sense. I'm also seeing another type of respiratory medication mentioned in our sources. These are leukotriene receptor antagonists, or LTRAs. Montelukast, which is also known as Singulair, is an example.
Right.
These seem to be less commonly used
Yeah.
than the beta agonists or the inhaled corticosteroids. Why is that?
So LTRAs are different from those other two in that they work by blocking leukotrienes,
Okay.
which are chemicals that can trigger inflammation and airway constriction.
Okay.
So they're mainly used for managing asthma and allergies over time, not for those sudden attacks. They can be especially helpful for people who have allergy-induced asthma.
Okay, so they're more of like a preventative measure.
Right.
But are there any potential side effects to be aware of with those?
They do. While they're generally considered safe, there have been some reports of mood changes associated with these medications, so that they're not typically the first choice for treating asthma.
Gotcha. It seems like with all of these respiratory medications, it's really crucial to have those open and honest conversations with your doctor.
Absolutely.
Understanding the why behind your treatment choices is so important.
Shared decision-making is key when it comes to finding the best approach for each individual.
For sure. Now, how about we move on to something that probably affects everyone at some point?
Yeah,
Digestive
for
issues,
sure.
from heartburn to constipation. I think we've all experienced, the discomfort of digestive problems.
Oh, absolutely. And the range of medications that are available to try to address these issues is pretty amazing.
Yeah, there really is like a wide variety of medications that target, different aspects of digestion.
Yeah,
We've got antacids, we've got H2 blockers, proton pump inhibitors, antiemetics, the laxatives, the list goes on.
it does.
So let's start with what seems like kind of the nuclear option when it comes to tackling stomach acid, and that's those proton pump inhibitors or
Right.
PPIs. And I know omeprazole, also known as Prilosec, is a popular PPI.
Yeah, PPIs are extremely effective for conditions like GERD or peptic ulcers because they work by shutting down the proton pump, which is the enzyme responsible for producing stomach acid,
So they basically like turn off the acid production in your stomach.
pretty much.
But I've heard that, long-term use of PPIs can be kind of risky. What are the concerns there?
So while they're generally safe for short-term use, long-term use of PPIs has been linked to several potential problems. There's possible increased risk of bone fractures, possibly because they can interfere with calcium absorption.
Yeah.
Um, and there's even some research suggesting that long-term use might make you more vulnerable to certain gut infections. So
Wow.
not exactly what you want when you're, trying to treat your stomach.
That's definitely something to consider. So if PPIs are like the heavy hitters, what are the gentler options for dealing with stomach acid? I remember ranitidine or Zantac used to be a popular choice.
Right, you're thinking of the H2 blockers. They work by blocking histamine receptors in the stomach, which helps to reduce that acid production.
Gotcha.
So they're not as strong as the PPIs, but they're still effective for a lot of people with mild to moderate acid reflux.
Okay, so they work a little differently, but still kind of target in that excess stomach acid.
Exactly.
What about other digestive issues like nausea and vomiting? Are there medications that can help with that?
Yes, so we have a whole category of medications called antiemetics that are designed to reduce that nausea and vomiting.
Oh,
Uh,
okay. So that's good to know because I think we've all experienced those uncomfortable feelings at some point in our
we
life.
have. So ondansetron, also known as Zofran, is a very effective antiemetic that's commonly used to prevent nausea and vomiting associated with chemotherapy and surgery.
No. Okay.
It works by blocking serotonin receptors in the brain and the gut.
Serotonin receptors. Now those sound familiar from our earlier discussion about antipsychotics. It's amazing how those same receptors are involved in so many different bodily processes.
It really highlights how interconnected everything is.
Right.
Another antiemetic, metoclopramide, works a little differently.
Right.
So it actually helps to speed up the movement of food through the digestive tract.
Okay, so we've got the PPIs and the H2 blockers that are targeting stomach acid. We've got the antiemetics targeting nausea and vomiting.
Right.
What about the other end of the spectrum, talking about constipation, which, let's be honest, is something that affects most of us at some point?
It's very common, and there are a variety of laxatives available to help.
Okay, so break it down for me. What are the different types of laxatives and how do they work?
So there are several types of laxatives that work in different ways. Some, like the Sacadil, actually stimulate the muscles of the intestines
Okay.
to kind of get things moving.
Okay.
Others, like polyethylene glycol or PEG, work by drawing water into the colon to soften the stool. And then we have bulk-forming laxatives like psyllium, which basically add fiber to your diet to make the stools larger and easier to pass.
Wow. So many options, but how do you know which type is right for you?
That's a great question, and it's always best to discuss with your doctor. But in general, the bulk-forming laxatives are considered the safest for long-term use because they work more naturally with your body.
Okay.
The stimulant laxatives should only be used for short periods, as they can sometimes lead to dependence and actually worsen the constipation over time.
Oh, that makes sense. I think it's important to remember that managing digestive health often involves more than just medication.
Absolutely.
It's
Lifestyle changes,
Yeah.
like diet and exercise, are equally important.
It's all about finding that balance.
Mhm.
And as always, it's a good idea to talk to your doctor before starting any new medications, especially for digestive issues, because they can sometimes be a symptom of a more serious underlying problem.
Couldn't agree more. We've covered a lot of ground today, from anti-inflammatories all the way to gastrointestinal medications.
It's been quite a journey through the world of medications, but there's so much more to explore. So join us in part 2 as we continue our deep dive.
See you there. Welcome back to our deep dive into the world of medications. Before we move on, I think it's worth reiterating that what we're doing here is really just scratching the surface. You know,
Hmm.
it's about giving you a foundation so you can have more informed conversations with your doctor.
Absolutely. It's all about understanding the basics so you can be a more active participant in your own healthcare decisions.
Right.
Now, let's shift our focus to a category of medications that has truly revolutionized medicine, antibiotics.
Yeah, antibiotics have saved countless lives,
Hmm.
but they're also, facing some pretty big challenges these days. And I think the biggest one is this issue of antibiotic resistance.
Yeah, antibiotic resistance is definitely a scary thought. It seems like we're hearing more and more about it these days.
It's a very real and growing threat. But before we dive into the complexities of antibiotic resistance,
Yeah.
I think it's important to appreciate just how remarkable these drugs are.
Okay, so back to basics. How do antibiotics actually work? What makes them so effective against bacteria but not, say, against viruses?
That's a great question, and it highlights a fundamental difference between bacteria and viruses. So bacteria are single-celled organisms with their own unique machinery for survival.
Okay.
They have ribosomes for building proteins, cell walls for structural integrity, and enzymes for replicating DNA. So antibiotics work by targeting these specific bacterial structures and processes,
Okay.
essentially disrupting their ability to grow and multiply.
So they're like tiny saboteurs sneaking into bacterial cells and causing chaos.
Exactly, and the beauty of it is that they largely leave human cells unharmed
Oh, okay.
because our cells have different structures and processes.
Yeah. That's incredible, but there's so many different types of antibiotics out there, penicillins, cephalosporins, tetracyclines, fluoroquinolones, the list goes on and on.
It does.
How can the average person even begin to understand the differences between all of them?
It definitely seems overwhelming at first,
Yeah.
but once you understand the basic mechanisms, it starts to make more sense.
Yeah.
So, for example, penicillins, which were one of the first classes of antibiotics discovered, they work by preventing bacteria from building strong cell walls.
Okay.
So without that sturdy wall, the bacteria become vulnerable and can actually burst. Cephalosporins work similarly, but they're effective against a wider range of bacteria.
Okay, so both of those target the cell wall.
Right.
What about tetracyclines and fluoroquinolones? How do those work?
So tetracyclines interfere with the bacteria's ability to build proteins,
Okay.
essentially cutting off their supply of essential building blocks.
Oh, wow.
Fluoroquinolones, on the other hand, they target DNA replication, stopping the bacteria from multiplying.
Gotcha.
You can see each class of antibiotics has its own unique way of attacking those bacterial invaders.
It's like a multi-pronged assault on those tiny invaders.
Hmm.
But unfortunately, as we were saying before, not all bacteria are created equal. Some are becoming resistant to these antibiotics.
You're absolutely right. Antibiotic resistance is one of the most pressing public health threats that we face today. And it's really driven by this overuse and misuse of antibiotics,
Hmm.
both in humans and in animals.
Okay, so how does this resistance actually develop? It seems like bacteria are incredibly adaptable.
Yeah, are incredibly adaptable, so they're constantly evolving, always looking for ways to survive.
Right.
So when they're exposed to an antibiotic, the ones that happen to have mutations or genes that allow them to resist that drug's effects, those are the ones that will survive and multiply.
Right.
And then they pass those resistance traits onto their offspring.
It's like a real life example of natural selection, but with potentially dangerous consequences.
Exactly. And what's even more concerning is that bacteria can actually share these resistance genes with each other.
Oh, wow.
So resistance can spread very, very quickly through a population.
So we're essentially contributing to the creation of superbugs by not using antibiotics responsibly.
That's the risk we're facing, and these superbugs are very difficult to treat.
Yeah.
Infections that are caused by these resistant bacteria are much harder to clear up. They carry a higher risk of complications and even death.
Okay, that is scary, but what can we do about it? I know I'm probably guilty of asking for antibiotics when I probably didn't need them.
You're not alone. It's really important to remember that antibiotics only work against bacterial infections, not viral infections like the common cold or the flu.
Oh, okay.
So taking antibiotics for a viral infection won't help you get better
Yeah.
and will only make that problem of antibiotic resistance worse.
So step one is making sure that you actually have a bacterial infection before taking antibiotics.
Exactly. And if you are prescribed antibiotics, it's incredibly important to take them exactly as directed.
Mhm.
And to finish the entire course of treatment, even if you start to feel better,
Right.
before you've taken all those pills.
Right. I know it can be tempting to stop taking them once you're feeling better, but I can see how that would give the surviving bacteria a chance to develop that resistance and make things worse in the long run.
Exactly. It's also important to practice good hygiene. Wash your hands frequently, things like that, to help prevent the spread of infections in the first place.
So it sounds like we all have a part to play in tackling this antibiotic resistance. It's a shared responsibility between doctors, patients, even the agricultural industry.
I agree. It's a complex problem,
Yeah.
but by understanding the science behind it, we can make more informed decisions and hopefully help preserve the effectiveness of these life-saving drugs for future generations.
Yep.
Now, how about we switch gears and delve into the fascinating world of hormones?
Okay.
These chemical messengers that influence everything from our mood to our metabolism.
Hormones, they're like these tiny but powerful forces that control so much of our biology. I'm definitely ready to unravel their mysteries.
Hormones are truly remarkable, and their effects are so far-reaching. We'll start by exploring the major endocrine glands, which are like the body's hormone factories.
Okay.
So we have the pituitary gland, the thyroid gland, the adrenal glands, just to name a few.
Okay, so imagine these glands as these bustling factories, each producing its own unique set of products, hormones that are shipped throughout the body to carry out specific tasks. What are some of the key hormones these factories produce, and what do they do?
Well, the pituitary gland, it often gets called the master gland. It
No.
sits at the base of the brain, and it produces a variety of hormones that regulate growth, metabolism, reproduction, other vital functions.
Hmm.
One of its most important products is growth hormone, which, as the name suggests, stimulates growth and cell regeneration.
So that's what helps us grow from tiny babies into fully grown adults.
Exactly.
What else does the pituitary gland do?
So the pituitary gland is also responsible for regulating the thyroid gland, the adrenal glands, the reproductive organs. Think of it as like the CEO of the endocrine system,
Okay.
coordinating and directing all the different departments.
It sounds like it plays a pretty crucial role in keeping everything running smoothly.
It does.
Okay, so what about the thyroid gland? I know it's located in the neck, but what exactly does it do?
So the thyroid gland is essential for regulating metabolism, energy production, and body temperature. It produces two key hormones, thyroxine, also known as T4, and tridothironidine, or T3. And these hormones act like a thermostat for your body, controlling how quickly you burn calories and how efficiently your cells use energy.
Okay, so if your thyroid is working as it should, you're like a well-oiled machine burning energy efficiently. But but what happens if it's not functioning properly? I've heard of conditions like hypothyroidism and hyperthyroidism.
Right, so hypothyroidism means the thyroid gland is underactive.
Okay.
It's producing too little thyroid hormone, and this can lead to fatigue, weight gain, depression, other symptoms that are related to a slowed metabolism. Hyperthyroidism, on the other hand, means the thyroid is overactive, producing too much hormone, so this can lead to weight loss, a rapid heartbeat, anxiety, other symptoms related to a sped up metabolism.
It sounds like finding that balance is important when it comes to thyroid hormones. And speaking of balance, I'm noticing a theme here. Balance seems to be key when it comes to hormones in general.
You're definitely picking up on something important. Maintaining hormonal balance is crucial for overall health and well-being. So let's move on now to the adrenal glands. These are tiny triangular glands that sit on top of your kidneys,
Okay.
and they're responsible for producing some very important hormones, including cortisol, adrenaline, and aldosterone.
I've definitely heard of cortisol and adrenaline. They're often associated with stress, right?
That's right. So cortisol is often called the stress hormone because it's released in response to stress. It helps the body to kind of cope with challenging situations. It increases blood sugar levels, suppresses the immune system, helps regulate blood pressure. Adrenaline, also known as epinephrine, is another stress hormone that triggers that fight or flight response, preparing the body for action
Okay.
by increasing heart rate, blood pressure, and alertness.
So those are the hormones that kick in when we're facing a tight deadline or running from a saber-toothed tiger. What about aldosterone? What does that one do?
So aldosterone plays a crucial role in regulating salt and water balance in the body.
Okay.
It acts on the kidneys, promoting sodium reabsorption and potassium excretion, which helps regulate blood volume and blood pressure.
Wow. So These tiny adrenal glands have a big job. They're like the body's emergency response team as well as the fluid balance managers.
That's a great way to put it. And they illustrate the interconnectedness of the endocrine system. You know,
Mhm.
hormones from one gland can influence the activity of other glands, creating this complex web of interactions that keep the body functioning smoothly.
It's like a delicate dance of hormones. Each plant is part in the symphony of life. But what happens when this dance is disrupted? I'm thinking of conditions like diabetes, which involves the hormone insulin.
Right. So diabetes is a great example of how hormonal imbalances can lead to serious health problems. So insulin, which is produced by the pancreas, is a key hormone that regulates blood sugar levels. In type 1 diabetes, the immune system attacks the insulin-producing cells in the pancreas, leading to a lack of insulin. In type 2 diabetes, the body becomes resistant to insulin's effects, or the pancreas doesn't produce enough insulin to keep up with demand. And both types result in elevated blood sugar levels, which can damage blood vessels, nerves, and organs over time.
So insulin is like the key that unlocks the door for glucose to enter cells and be used for energy.
Hmm.
Without enough insulin, that glucose builds up in the blood, causing all sorts of problems.
That's a great analogy. It really highlights the importance of understanding how hormones work
Right.
so we can better manage conditions like diabetes. Now, how about we explore another fascinating hormone, melatonin, the sleep hormone?
Melatonin, I've definitely heard of that one, especially in the context of sleep supplements. What's the story behind this hormone and why is it so important for sleep?
So melatonin is produced by the pineal gland, a tiny gland located deep within the brain, and its production is regulated by light exposure.
Okay.
So when it gets dark outside, the pineal gland starts producing melatonin, signaling to the body that it's time to sleep. As daylight approaches, melatonin production decreases, helping us to wake up.
So it's like our internal clock keeping our sleep-wake cycle in sync with the natural rhythms of day and night?
Exactly. Melatonin plays a crucial role in regulating our circadian rhythm, which governs so many of our bodily processes, including sleep, hormone production, body temperature.
But modern life, with its artificial lights and late-night screen time, seems to be disrupting our natural melatonin production. I know I'm guilty of scrolling through my phone in bed, and I'm sure it's not helping my sleep.
You're right. So exposure to bright light, especially blue light that's emitted from electronic devices, can suppress melatonin production
Okay.
and disrupt those sleep patterns. That's why it's so important to create a sleep-conducive environment. Dim the lights, avoid screens for at least an hour before bed.
Okay, noted. I'm putting my phone away tonight.
Good.
So with all these different hormones at play, it seems like finding that perfect balance is key to maintaining overall health and well-being.
Absolutely. Hormones are powerful regulators, and even small imbalances can have significant effects on our physical and mental health.
I'm really starting to appreciate the complexity of the endocrine system and how crucial it is for everything from growth and development to stress response and sleep regulation. It's amazing how these tiny chemical messengers can have such a profound impact on our lives.
It truly is remarkable. We've only scratched the surface of this fascinating field,
Yeah.
but I think we've laid a solid foundation for understanding the basics of hormones and how they influence our health.
This has been incredibly insightful, I feel like. I'm starting to see the connections between all these different systems in the body.
That's what we're hoping for. It's
Right.
all about connecting the dots and understanding the bigger picture.
Hmm. Well, on that note, I think we've covered a lot of ground in this part of our deep dive, but there's still so much more to explore. Join us in part 3, where we'll delve into the future of medicine and discuss some of the exciting advancements on the horizon. Welcome back. It's amazing to think that we've covered anti-inflammatories, antibiotics, and hormones all in one deep dive. But now I'm really excited to look ahead and explore what the future holds for medicine.
It really is an incredible time for medical advancements. There are so many exciting discoveries happening right now that are changing the way we understand and treat disease.
Yeah, I've heard a lot about personalized medicine lately. It seems like it could be a real game changer. What can you tell us about it?
So personalized medicine is all about tailoring treatment to an individual's unique needs. So it takes into account their genetic makeup, their lifestyle, environmental factors, all the things that make them unique.
So instead of that one size fits all approach, it's more about finding the right treatment for the right person at the right time.
Precisely. For example, let's say two people are diagnosed with the same type of cancer. In the past, they might have received the same, standard treatment, even though their bodies might respond differently to it.
Right. I can see how that wouldn't be the most effective approach. Everyone is different. So it makes sense that their treatments should be individualized as well.
Exactly. So with personalized medicine, doctors can use genetic testing and other tools to kind of predict how an individual is likely to respond to a particular treatment.
Okay.
And this helps to minimize side effects and increase the chances of success.
That sounds amazing. Are there any like specific examples of how this is being used in practice today?
Oh, absolutely. One area where personalized medicine is already making a big difference is in cancer treatment.
Okay.
So by analyzing the genetic mutations that are present in a tumor, doctors can actually identify targeted therapies that are more likely to be effective.
So it's like fighting cancer with pinpoint accuracy, targeting the specific vulnerabilities of those tumor cells.
That's a great way to put it. And this approach is already improving outcomes for many patients. Personalized medicine is also making inroads in the treatment of cardiovascular disease, Alzheimer's disease, even mental health disorders.
It seems like the potential applications are endless.
They really are. It's an exciting time for medicine, but of course, with any new approach there are challenges to overcome.
Yeah. What are some of the hurdles that personalized medicine still faces?
So cost is a major factor.
Right.
Genetic testing and other diagnostic tools can be expensive. We also need more research to identify the specific genes and biomarkers that are most relevant for predicting treatment responses. And there are, important ethical considerations to address, especially when it comes to privacy and data security.
Those are all important points, but it sounds like the potential benefits of personalized medicine far outweigh the challenges. I'm optimistic that as technology continues to advance and costs go down, we'll see this approach become more widely available.
I agree. Personalized medicine holds immense promise for the future of healthcare.
Hmm.
Another area that's revolutionized in medicine is immunotherapy, and this involves using the body's own immune system to fight disease.
Oh, wow. Yeah, I've heard a lot about immunotherapy, especially in context of cancer treatment. Can you explain how it works?
Yeah, so there are different types of immunotherapy, but they all essentially involve boosting or manipulating the immune system to help it recognize and attack diseased cells.
Okay.
So, for example, in cancer treatment, some immunotherapy drugs help the immune system to identify and target cancer cells that it might have missed before.
So it's like training the immune system to be a more effective fighter against those harmful cells.
That's a great analogy, and this approach has been remarkably successful in treating certain types of cancers,
Yeah.
like melanoma, lung cancer, leukemia. Researchers are also exploring the use of immunotherapy for other conditions like autoimmune diseases, infectious diseases, even neurodegenerative disorders.
Wow, it sounds like immunotherapy could have a major impact on how we treat a wide range of diseases. Are there any risks involved in manipulating the immune system like this?
There are definitely risks to consider. One of the main challenges is managing the side effects, which can range from, mild flu-like symptoms to more serious autoimmune reactions.
Hmm. So it's a powerful tool, but one that needs to be used carefully and with a clear understanding of the potential risks and benefits.
Exactly. And researchers are working hard to refine these immunotherapy treatments to make them even more effective and safer. Speaking of powerful tools, another area that's transforming medicine is nanotechnology.
Nanotechnology. Now that sounds futuristic.
It does, doesn't it?
Mm.
Nanotechnology involves manipulating materials at the atomic and molecular level.
I can barely wrap my head around how small that is.
It's incredibly tiny, but despite its size, it's already having a big impact on medicine. For example, nanoparticles can be used to deliver drugs directly to cancer cells, minimizing those side effects on healthy tissues.
So it's like those tiny saboteurs we talked about earlier, but this time we're sending them on a guided mission to precisely target the enemy.
That's a great way to visualize it. Nanotechnology is also being used to create new imaging techniques that can detect diseases earlier and with greater precision.
So it's not just about treatment, it's also about early detection and diagnosis.
Exactly. And some researchers are even exploring the use of nanomaterials to repair damaged tissues and organs.
It sounds like the possibilities with nanotechnology are limitless.
It really does feel that way, and these are just a few of the amazing frontiers in medicine, from gene editing to artificial intelligence. Scientists are constantly pushing the boundaries of what's possible.
Right.
It's an incredibly exciting time to be alive, especially if you're fascinated by science and health.
I completely agree. I feel so energized after this deep dive. Like I've been given a glimpse into the future of healthcare. It's inspiring to think about all the incredible innovations that are happening right now and the potential they hold for improving lives.
It's been a pleasure sharing this exploration with you as we wrap up our deep dive. I want to leave you with a final thought. With all these incredible advancements in medicine, it's more important than ever to stay informed, engage in thoughtful discussions, and advocate for a future where these innovations are used responsibly and for the benefit of all. That's a great point to end on. We all have a role to play in shaping the future of healthcare. Thanks for joining us on this incredible journey through the world of medications. We'll see you next time for another fascinating deep dive.
All right, so it looks like we're diving into some pretty powerful medications today.
Yeah, the ones that keep our hearts going, our blood sugar balanced, all those things that keep us running smoothly.
Yeah, like antihypertensives, antidiabetics,
Oh,
anticoagulants.
and let's not forget antiepileptics and corticosteroids.
Right, so we're talking about some serious stuff here.
It seems like you've done some research.
I try to, get a good handle on things before we dive in.
Yeah, well, you've definitely got a stack of info here about all these medications.
Well, I want to make sure we cover it all, not just the basics.
It seems like you're interested in the nitty-gritty, the hows and whys,
Exactly, like the mechanisms, the
the
uses.
things to watch out for, all those crucial details.
Exactly, because whether you're taking these meds yourself, or maybe you're caring for someone who is, or even if you're just fascinated by how our bodies work.
This deep dive is for you.
Okay, let's start with antihypertensives.
So those are the medications designed to tackle high blood pressure.
Right, which is often called the silent killer.
Yeah, it could really do some damage without you even realizing it.
And there's a whole bunch of different types of antihypertensives.
Each with their own way of bringing that pressure down.
Let's unpack that.
Okay, so first up, we've got beta blockers.
Beta blockers, those sound like they're all about chilling out.
Yeah, basically they worked by calming the heart down.
So they kind of slow down the heart rate and the force of each beat.
Exactly, like hitting the brakes on your heart a little bit.
Okay, so like if my heart's about to go on a sprint, a beta blocker helps it take a leisurely walk instead.
Exactly. But here's the thing.
What's that?
Some beta blockers, like propranolol, can also affect the lungs.
So if someone has asthma, beta blockers might not be the best choice.
Right. Not ideal in that situation.
Got it. Now what about ACE inhibitors?
Those are sneaky little things.
Sneaky in what way?
They actually disrupt the body's own blood pressure raising system.
How do they do that?
So our bodies produce this chemical called angiotensin II, which makes our blood vessels constrict, like squeezing a hose, that kind of thing.
So it increases the pressure inside?
Exactly. And ACE inhibitors block the production of angiotensin II.
Ah, so it's like loosening the grip on the hose, making it easier for the blood to flow through.
You got it. And not only does this lower blood pressure, but it can also protect the kidneys.
Oh, especially important for people with diabetes.
Right. They're at higher risk for kidney damage.
Okay, that's pretty impressive. Two birds with one stone.
Now we've also got ARBs.
ARBs, are those similar to ACE inhibitors?
They are. They're like cousins, you could say.
Okay, so how do they work?
Instead of preventing the production of angiotensin II, they block the receptor where it would normally attach.
So it's like shutting the door on angiotensin II.
Exactly. Sorry, we're full. Come back later.
I like that, and this is particularly helpful for people who get that cough from ACE inhibitors.
Right, that can be a common side effect.
All right, on to calcium channel blockers. Those sound a bit more complex,
Well, calcium is essential for muscle contractions.
including the muscles in our blood vessels.
Exactly. So calcium channel blockers, they limit the amount of calcium that can get into those muscle cells.
So they're basically telling the blood vessels to relax, let the blood flow more easily.
You could say that it's like trying to force water through a narrow hose. It takes a lot of pressure.
But if you widen that hose,
The water flows much easier.
that makes sense. And finally, we have diuretics.
Those are often called water pills
Right. They just help your body get rid of excess fluid.
for urine. Yeah.
Less fluid, lower blood pressure.
Simple but effective.
It's like releasing some steam from a pressure cooker.
Exactly. And often a good first choice, especially for older adults.
Okay, so we've covered the basics of antihypertensives. Now let's move on to antidiabetic medications,
All right, so those are all about keeping blood sugar in check.
which is essential for energy but can be a problem when it's too high.
Right. And diabetes is all about the body's ability to use insulin properly.
Insulin being the hormone that regulates blood sugar.
Exactly. So for people with type 1 diabetes,
Their bodies don't produce insulin at all.
so they need to take insulin to replace what's missing.
Literally a lifesaver in that case.
But for type 2 diabetes,
The body still produces some insulin.
but it doesn't use it efficiently.
So it's like, we've got insulin, but we're not quite sure how to use it.
Yeah, and that's where oral hypoglycemic medications come in.
Those are the pills we often hear about.
Right. And leading the charge is metformin.
Metformin, I've heard that name a lot. What makes it so special?
Well, it tackles high blood sugar on two fronts. First, it lowers the amount of glucose produced by the liver.
Okay.
And second, it helps the body's cells become more sensitive to insulin.
So they can use glucose more effectively?
Exactly. But what really sets metformin apart is that it doesn't cause weight gain,
Oh, in fact, it might even contribute to weight loss.
which is a big plus for a lot of people with type 2 diabetes.
Yeah, weight management is a huge concern for many.
So metformin is a bit of a superstar in that regard.
Okay, I see why it's so popular, but what about other options?
Well, there are sulfonylureas.
How do those work?
They work by boosting insulin release from the pancreas.
So it's like giving the pancreas a little pep talk.
Yeah, telling it to step up its insulin production.
But there's a catch, right?
There is. Sulfonylureas can sometimes cause blood sugar to dip too low.
If not managed carefully.
Exactly. So monitoring is key with these medications.
Makes sense. You don't want to go overboard with the pep talk and end up with too much insulin.
Right. Now let's move on to GLP-1 agonists.
GLP-1 agonists, what are those all about?
These medications mimic a hormone found in our gut.
Which helps regulate blood sugar.
But here's the interesting part.
What's that?
It also promotes a feeling of fullness.
So it helps manage blood sugar and can help you feel full,
Exactly. Kind of a win-win situation.
especially for those struggling with weight management.
Right. It's becoming increasingly popular for that reason.
Okay, so a lot of these medications are multitaskers. What about SGLT2 inhibitors?
Those work in a pretty unique way.
How so?
They act in the kidneys, preventing glucose from being reabsorbed back into the bloodstream.
So instead of being reabsorbed, that glucose is just flushed out,
Exactly. Think of it like a one-way street for glucose.
straight out through the urine.
And what's particularly interesting is that they've shown promise in protecting both the heart and kidneys.
Wow, so they're helping manage blood sugar and potentially protecting those vital organs?
Pretty impressive, right?
It is. All right, let's shift gears and talk about anticoagulants and antiplatelets,
Okay, so we're talking about preventing blood clots,
which can lead to some serious conditions.
deep vein thrombosis, pulmonary embolism, stroke, you name it.
Okay, so these are the heavy hitters of the medication world.
They are crucial players, that's for sure.
Let's break it down. First up, we have warfarin.
Warfarin, that's been around for a while.
How does it work?
It interferes with vitamin K, which is needed to make clotting factors.
So it's basically saying, nope, not today, blood clots.
Yeah, we're shutting down your production line.
I like that, but I've heard warfarin can be a bit tricky to manage.
It can. It requires careful monitoring and dietary adjustments.
What kind of dietary adjustments?
Well, things like leafy green vegetables, they're high in vitamin K.
Ah, so they can interfere with warfarin's effectiveness.
Exactly. And there are also a lot of drug interactions to be aware of.
So it's effective, but requires a high level of attention.
You could say that, but luckily we now have DOACs,
DOACs, what are those?
direct oral anticoagulants.
And they're easier to manage.
They are. They directly target specific clotting factors.
Okay.
So they can be given in fixed doses.
No need for constant monitoring.
Right. Much simpler.
That's a big win, but I'm guessing there are still some risks.
Of course, all anticoagulants carry a risk of bleeding.
Right, so monitoring and careful assessment are still necessary.
Absolutely. Now, what about heparin?
Heparin, I've heard that one used in hospitals.
Yeah, heparin's like the SWAT team of anticoagulants.
It works quickly,
Very quickly, it's used in acute situations,
like when someone's having a heart attack.
or deep vein thrombosis, things like that,
So it's fast-acting, but needs close monitoring.
usually through blood tests.
Okay, and last but not least, aspirin.
Ah, aspirin, the multitasker.
We usually think of it for pain relief.
Right, but it also has this ability to prevent blood clots.
How does it do that?
It inhibits platelet clumping,
Platelets being those tiny cell fragments that are essential for clotting.
Exactly. They're like the first responders rushing to the scene of an injury.
So aspirin is saying, hold on, platelets, let's not get too carried away here.
Exactly. We don't want a traffic jam of cells.
That's why low-dose aspirin is often recommended for people at risk of heart attack or stroke.
Right. It helps prevent those clots from forming in the arteries.
Okay, so we've covered a lot of ground here with anticoagulants and antiplatelets. Ready to move on to antiepileptics.
Let's do it. Those are the medications designed to calm the electrical storms in the brain,
Right. Epilepsy is all about abnormal brain activity.
leading to seizures.
And these medications aim to stabilize that activity.
Prevent those seizures from happening.
It's all about bringing balance and control to those electrical impulses.
And there are a range of medications, each with a slightly different approach.
Let's dive into that.
Okay, so some of the older medications like phenytoin and carbamazepine,
Yeah.
they focus on stabilizing those neuronal membranes.
By working on sodium channels.
Right, those are the pathways that help transmit electrical signals in the brain,
So it's like they're fine-tuning those channels.
making sure the signals are flowing smoothly.
Preventing any sudden surges.
Exactly. And these medications are quite effective, but they can have some serious side effects.
So careful monitoring is key.
Absolutely. It's all about finding that balance between controlling seizures and managing side effects.
That makes sense. Now what about valproic acid?
Valproic acid is interesting because it has multiple mechanisms of action.
Oh, so it's effective for various types of seizures.
It is, but there's something important to note.
What's that?
It's not safe to use during pregnancy.
Ah, because of the risk of birth defects.
Exactly. It highlights the importance of careful consideration when prescribing medications, especially during pregnancy.
Every situation is unique. It's about weighing the benefits against the risks.
Right. Now, how about lamotrigine?
Lamotrigine, I've heard that one is generally well tolerated.
It is, but it requires a slow and steady dose increase
Why is that?
to avoid a rare but serious skin rash.
So even though the side effects are generally less intense, a gradual approach is still crucial.
Slow and steady wins the race with this one.
I like that. Now, what about levetiracetam?
Levetiracetam, that's a newer option.
And it's generally considered safe.
It is, with fewer drug interactions compared to some of the older medications.
Fewer drug interactions, that's always a good thing.
And no routine blood level monitoring needed.
Really? That makes it much easier to manage.
It does, but it's worth noting that it can potentially cause mood and behavioral changes in some people.
Oh, interesting. So it's not just about controlling seizures, but also being aware of potential psychological side effects.
Exactly. It's a reminder that medications can impact the whole person, not just the specific condition they're treating.
Open communication with your doctor is so important.
Couldn't agree more. All right, ready for our final category.
Corticosteroids, those are known for being potent inflammation fighters.
They are, but they also come with some potential baggage.
Right. Long-term use can have some downsides.
It's like a powerful tool that needs to be used with caution.
So wielding them wisely is key. Let's start with prednisone.
Prednisone, that's one of the most commonly used corticosteroids.
Used for a wide range of conditions.
It is, from autoimmune diseases to asthma flare-ups.
So it's handy to have around.
It is, but there are some caveats.
I'm sure there are. What are they?
While incredibly helpful in the short term, long-term prednisone use can lead to weight gain,
Okay.
increased blood sugar, even thinning of the bones.
So it's not something you want to be taking lightly.
Definitely not. It requires careful consideration of the benefits versus the risks.
All right. So not like popping candy. What about hydrocortisone?
Hydrocortisone is often used when the adrenal glands aren't functioning properly.
Right. It replaces the body's natural cortisol.
Exactly. And like prednisone, it also has anti-inflammatory properties.
So it's filling in for a missing hormone while also tackling inflammation. But does it come with similar side effects?
While generally considered safer than prednisone for long-term use, it still carries similar risks, though they might be less pronounced.
So again, it's all about weighing the benefits against the risks for each individual.
Couldn't agree more. Now on to dexamethasone.
This one sounds like it means business.
Dexamethasone is the heavy hitter of corticosteroids. It's incredibly potent.
Okay.
Reserved for those severe cases where a strong anti-inflammatory response is absolutely necessary.
But with great power comes great responsibility.
You could say that. The risk of those unwanted side effects is even higher with this one.
So it's like bringing out the big guns, but you have to be very strategic and cautious.
Exactly. And lastly, we have budesonide.
Budesonide, what's special about that one?
It's designed for more localized action, meaning it targets specific areas rather than affecting the whole body.
So instead of a widespread effect, it's more like a targeted strike.
Exactly. You can inhale it to reduce inflammation in the lungs.
For asthma.
Right. Or you can take it orally or rectally to target inflammation in the gut.
For conditions like Crohn's disease or ulcerative colitis?
Exactly. So it's all about delivering the medication right where it's needed.
Minimizing the impact on the rest of the system.
That often translates to fewer systemic side effects.
Which is a major advantage.
It is. We've covered a lot of ground, but I feel like we've only just scratched the surface.
It's true, there's so much more to learn about these medications.
There is, but even understanding the basics of how they work can empower you to ask the right questions.
Advocate for your health, make more informed decisions.
Absolutely. And it's fascinating to think about how these seemingly simple pills can have such profound effects on our bodies.
It really is. It's mind-blowing.
So we still got more to cover. Ready to dive deeper?
I'm all ears. Bring on the knowledge.
Okay, so we were talking about levetiracetam and how it's pretty easy to manage.
Yeah, fewer drug interactions, no routine blood monitoring. Sounds good.
It is. But, we did mention that it could have some effects on mood and behavior.
Right. What were those again?
Well, some people experience mood swings or changes in their behavior, while taking it.
So it's not just about controlling seizures, it's also about thinking about those mental and emotional effects.
Exactly. It's like our systems are all connected, right? So a medication for one thing can affect something else completely.
It's true. That's why talking to your doctor is so important.
Absolutely. Communication is key.
Now, what about valproic acid? We talked about how it's effective for different types of seizures, but it's off limits during pregnancy.
Right, because it can actually interfere with fetal development.
Leading to birth defects.
Yes, specifically neural tube defects. Those affect the brain and spinal cord.
So that's really serious stuff.
It is, and it really emphasizes how important it is to think about medications during pregnancy.
Working with your doctor to make the best choices.
Right, and it also shows how important it is to keep researching and developing safer alternatives.
Especially for pregnant women who need to manage epilepsy.
Exactly. Now, let's go back to phenytoin for a minute.
Phenytoin, that's one of those older medications we were talking about.
Right, it works by stabilizing those neuronal membranes.
But it can also cause some side effects.
Yeah, one of the noticeable ones is gingival hyperplasia.
Gingival hyperplasia, that sounds pretty serious.
Well, it's basically an overgrowth of the gum tissue.
So it's not just a cosmetic issue.
No, it can actually affect your dental health.
So if you're taking phenytoin long-term, regular dental checkups are even more important.
Absolutely. Good oral hygiene is crucial.
It's a reminder that medications can have effects beyond what they're intended to treat.
They can. Now, what about carbamazepine?
Carbamazepine, that's another one that works on those sodium channels.
It does, but it comes with a black box warning.
A black box warning, that's the most serious one, right?
It is. It's about potential hematologic effects.
Hematologic, that means related to blood, right?
Exactly. We're talking about things like a granulocytosis and aplastic anemia.
Those sound pretty scary.
They are. It basically means the bone marrow isn't producing enough blood cells.
Wow, so those are definitely side effects you want to watch out for.
Absolutely. Regular blood tests are essential if you're taking carbamazepine.
To catch any problems early on.
Exactly. It seems like with these anti-epileptic medications, it's all about balance.
Finding that balance between controlling seizures and managing potential side effects.
And close monitoring, talking to your doctor, those are key.
Couldn't agree more. Now let's go back to corticosteroids.
Okay, those powerful inflammation fighters.
Right. Prednisone being the Swiss Army knife of corticosteroids.
Versatile, but tricky.
Exactly, and one of the concerns is its effect on metabolism.
Yeah, it can increase blood sugar, cause weight gain, fluid retention, even increase the risk of ulcers and gastrointestinal bleeding.
So it's not just about managing the inflammation, it's about thinking about those long-term consequences.
Right, it's like solving one problem but creating another.
What about bone health? Corticosteroids can affect that too, right?
They can. Long-term use of prednisone can interfere with calcium absorption and bone formation.
Leading to osteoporosis.
And fractures, yeah.
So it's like weakening the foundation of our skeletal system.
You could say that. That's why doctors often recommend calcium and vitamin D supplements.
To counteract those effects.
Exactly. It's all about mitigating those risks.
Okay, that makes sense. Now, what about hydrocortisone?
Hydrocortisone, we talked about how it's used as a cortisol replacement.
But it also has those anti-inflammatory properties.
It does. And while it's generally considered a bit safer than prednisone for long-term use,
we still need to remember those potential risks.
right, the effects on bone health, metabolism, those are still important considerations.
So it's all about personalized treatment plans.
Absolutely. What works for one person might not work for another.
Now, what about dexamethasone, that heavy hitter corticosteroid?
Dexamethasone, the big guns.
We're using that one with caution.
Absolutely. Because it's so potent, the risk of those side effects is much higher.
So it's like turning up the volume on those potential problems.
Exactly. That's why it's usually reserved for short-term use in those really severe situations.
When the benefits outweigh the risks,
Right. It's about strategic deployment.
then careful monitoring.
Absolutely. Now, butzenide, that one's designed for more localized action.
So theoretically, fewer systemic side effects.
In theory, yes, but
Yeah.
even with those targeted medications,
Some absorption can still happen.
especially with long-term use.
So it's not a complete free pass.
No, careful monitoring and using the lowest effective dose are still important.
Got it. Okay. Let's shift gears back to blood clot prevention.
Back to those anticoagulants.
Warfarin, the one that requires all the monitoring and dietary adjustments.
Right, and it interacts with a lot of other medications.
Like what?
Antibiotics, antifungals, even some over-the-counter pain relievers.
Wow. So it's really important to keep your doctor informed about everything you're taking.
Absolutely, no secrets when it comes to warfarin.
And what about those dietary interactions? We talked about leafy green vegetables.
Right, but it's not just those. Other foods high in vitamin K can also have an effect.
Like broccoli, Brussels sprouts.
Or even liver.
So it's not about avoiding those foods completely.
No, it's more about being consistent.
So sudden changes in your diet can throw things off.
Exactly. Now, DOACs, those are a bit more manageable, right?
They are. They have fixed dosing, fewer drug interactions.
Fewer dietary interactions.
So overall, much simpler to manage.
Definitely. But there's one thing to keep in mind.
What's that?
DOACs are mainly processed by the kidneys.
So if someone has kidney problems.
Those adjustments might be necessary.
So even with these newer medications, personalized medicine is still key.
It is. Now let's talk about heparin again.
Heparin, the rapid-acting anticoagulant.
The one we often see in hospitals.
Because it works so quickly.
It does. It's all about quick action in those urgent situations.
But it needs to be given by injection.
And requires close monitoring.
Through blood tests.
Right now, aspirin.
Aspirin, the pain reliever that also prevents blood clots.
It works by inhibiting platelet clumping.
Platelets being those first responders rushing to the scene of an injury.
Exactly. So aspirin is like, hold on, platelets, let's not overreact here.
We don't want a traffic jam of cells.
Right, and that's why low-dose aspirin is often recommended for people at risk of heart attack or stroke.
To prevent those clots from forming in the arteries.
Exactly, but there are some downsides to long-term aspirin use.
Like what?
The most common one is gastrointestinal upset.
Oh, like heartburn.
Yeah, it can range from mild to more serious.
Like ulcers or bleeding.
So again, it's about weighing the benefits against the risks.
Right, making sure the benefits outweigh those potential problems.
Okay, ready to dive back into diabetes medications.
Yeah, let's talk about those blood sugar regulators. So we were talking about metformin, that superstar for type 2 diabetes.
Yeah, it's a pretty amazing medication, tackles high blood sugar on multiple fronts.
Right, it lowers glucose production, improves insulin sensitivity.
And even has some good effects on cholesterol.
So it's like a triple whammy against those type 2 challenges.
It is, but it's important to remember,
What's that?
metformin's not for everyone.
Like who?
Well, people with kidney or liver problems, for example.
Ah, it can build up and cause complications in those cases.
Right, so careful assessment is always important.
Even with a medication that's generally considered safe.
Absolutely. Now, what about those sulfonylureas?
Sulfonylureas, those encourage the pancreas to release more insulin, right?
Yeah, think of it as a little nudge, a pep talk for the pancreas.
Telling it to step up its game.
Exactly. They can be very effective at lowering blood sugar. There's always a...
There is, what is it this time?
Well, they can also cause hypoglycemia.
Hypoglycemia, that's when blood sugar drops too low.
Right, so monitoring blood sugar levels is really important.
Especially when starting the medication or changing the dose.
Absolutely. Now, GLP-1 agonists, those seem to be getting a lot of attention these days.
They do. What's so special about them?
Well, they mimic a natural hormone that helps regulate blood sugar.
Okay.
But they also have another interesting effect.
What's that?
They promote feelings of fullness.
Oh, so they can help with weight management as well.
Exactly, a double benefit, which is why they're becoming so popular.
Especially for those struggling with both weight and blood sugar control.
Makes sense. Now, SGLT2 inhibitors, those work in the kidneys, right?
Yeah, they prevent glucose from being reabsorbed into the bloodstream.
Like a detour route for glucose.
Sending it out through the urine.
Exactly, a pretty clever way to lower blood sugar.
And they also have some other interesting effects.
Oh yeah, they've shown some real promise in protecting the heart and kidneys.
Which are often at risk in people with diabetes.
Exactly, so they're not just managing blood sugar, they're potentially protecting those vital organs as well.
That's amazing. Really highlights the complexity of the human body.
and how medications can have these far-reaching effects.
It's incredible. This whole deep dive has been a real eye-opener.
I'm glad you found it helpful.
I have. It's so important to understand how things work, especially when it comes to our health.
I agree. Knowledge is power.
It is, and this deep dive has definitely given me a lot to think about.
That's what we aim for, sparking that curiosity, encouraging critical thinking.
Empowering people to make informed decisions about their health.
Well said. It's been a pleasure exploring all this with you.
Likewise, until next time, stay curious, everyone.